Why don't we stand for the pledge? Senator Avard, lead us in the pledge.
I pledge allegiance
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I am going to open the hearing on our first bill, House Bill 1213, relative to immunization requirements for child care agencies, and I call the prime sponsor, Ross Berry, Representative Berry.
Good to see you. Thank you. I'm not the prime sponsor. The prime sponsor couldn't be here, but I am a sponsor, and I have committee in an hour, so it kind of worked out well. My name is Representative Ross Berry. I represent Manchester's Ward 689, Fighting South End. I'm here to introduce House Bill 1213, relative to immunization requirements for child care agencies. The title doesn't accurately reflect what the bill actually does. What the bill does is it makes it to our child care centers no longer have to collect immunization data. So it does not relieve the requirement to be vaccinated to attend a child care agency. I believe that's RSA 141C. So that requirement stays in place. So let me tell you kind of about why this bill came about. Child care centers have an inordinate amount of paperwork requirements. It would actually stun you the amount of paperwork we have to collect. Immunization records are something that we have to collect, and I believe we have to check up on them every 6 months. And then DHHS, when they do their annual inspections, they more like to do it more than annually, but they do them annually. They come by and they look for these things, and if you don't have it for one child, you get a notice of findings, which then becomes public. And the problem is insurance companies are taking these notice of findings for paperwork violations, and then they're jacking up the cost of insurance on child care agencies. And we've seen that happen time and time again. This bill was actually brought forward from testimony that we heard. A child care center in Rochester had their insurance rates tripled. A child care center in Dover recently shut down because they couldn't afford their insurance payments. So that was 100 and some odd children who lost child care overnight because they couldn't afford their insurance payments because the insurance company tripled them. If you're going to probably hear a lot of testimony afterwards about how this is an assault on public health or something like that, I will go back to the requirement to be vaccinated is not being removed. You still must be vaccinated. It is still the law. We're not touching that. We're touching the reporting requirements. The issue that they're going to say is this is going to affect the child care scholarship because the feds require that we collect this data. We already collect this data. When you go get immunized at a doctor in the state of New Hampshire, what's the first thing they ask you? Do you want to join the registry? So you can choose or not to choose to join that registry. And the same thing is true at a child care center. If you want to sign the religious waiver saying that you don't have to collect, you're not going to turn the information over, we take that. We don't ask you if that's a genuinely held belief. I don't sit there and say, to what extent do you believe in God, and is that why you're signing this waiver? Of course we don't ask that. That'd be grossly inappropriate, but we can take that. So the health argument's kind of moot because we allow the taking of a form on face value alone. So it's a pretty good bill, I think. The state has other ways to collect this. Child care centers should not be reporting arms for DHHS unless it's necessary. And I will go back to the law about being vaccinated is staying the same. So we're not saying you don't have to be vaccinated. The other thing that I will point out is somebody's going to come up here behind and say, I want to know that kids at my kid's child care center are vaccinated. You currently don't know that because we take a religious waiver. So that argument's moot too. There is literally no argument other than they might look at the scholarship, but I tend to believe in our federal delegation enough that they wouldn't allow our scholarship to be messed with. So the feds told us that we had to change our mile markers on our exit signs, and we didn't, and they didn't cut our funding. I'm incredibly skeptical that our senators and congressmen are going to allow our child care funding to be cut because we're reducing a needless paperwork requirement.
Thank you, Representative. Any questions from the committee?
Yeah.
Senator
Thank
Goodbar.
you. I'm looking at the methodology, and it says this bill, therefore, this bill may have an impact on the judicial and correctional system, which could affect prosecution, incarceration, probation, and parole costs for the state. Can you comment on that?
I have no idea where you're reading that from.
Okay, thank you.
I have no idea how it would either, because this is about childcare centers. So unless there's a lot of childcare centers, and I don't know.
So, yeah,
I have no clue where that came from. That's like so left field. I don't know.
interesting. All right, thank you.
Thank you. Any other questions? Seeing none.
Thank you.
All right, I'm on the right bill, right?
Yeah. Currently, we have no one else to speak, but we have, come on up, Representative.
Thank you, Representative Erica Leon from Derry, Vice Chairman of Health and Human Services. That note was from the original version of the bill. When it was amended, it's no longer relevant.
Gotcha.
Thank you.
Thank you.
Thank you. Hold on. Okay. Dr. Chen.
Testing, great. Good morning, Madam Chair, members of the committee. Thank you for hearing our testimony. My name is Ben Chan. I'm the state epidemiologist at the New Hampshire Department of Health and Human Services. I'm also an infectious disease physician. And I wanted to provide some information and take a position on this bill and let you know that we are opposed to House Bill 1213. Which we believe would remove the immunization requirements for children entering childcare. I think there has been some confusion and conflicting testimony on this bill, both here, but also when it was heard at the House Health and Human Services Committee. And I just want to point out that an amended analysis on the front page of this bill states the bill removes the immunization requirements for child care agencies. And if you look at section 1, immunization optional for child care agencies. So we believe that this bill would remove the immunization requirements for child care agencies, and therefore the department is opposed to this legislation. The bill also would remove vaccine documentation and reporting requirements, and hence remove any process for ensuring adherence to vaccine requirements for childcare entry. And we believe that this would indirectly and in effect also itself remove immunization requirements. Infectious diseases that were once eliminated from the US, such as measles and polio, are now making a comeback because of under-immunization. Measles, for example, was eliminated from the United States back in 2000. This year alone, there have been over 120 cases of measles in 2024. Most of these are outbreak-associated cases. There have been at least 7 outbreaks of measles across the United States. Thankfully, we have not had a case or an outbreak in New Hampshire. But we do have data on, thankfully, on childcare immunization levels, which have shown that relative to measles, the MMR vaccination has decreased over time. Currently, we're below 95% vaccination for the MMR vaccine within our childcare, which puts us at risk for the same thing happening in New Hampshire that we're seeing happen in other places across the United States. It's not just measles. polio has been found circulating just last year, I think actually 2022, 2023, in the New York area. And so as vaccination levels decrease, this is putting our children and our communities and our childcare agencies at risk. And so we are opposed to attempts that will remove vaccine requirements for childcare agencies or schools, either directly removing requirements or indirectly by removing the documentation and reporting requirements. I want to also just quickly note, and then I'll finish, that the documentation is important because it establishes a process to enforce the vaccine requirements. There's an assurance component here from the public health perspective, where public health has a role for assuring high vaccination rates at childcare agencies and schools. And it's also important for response. So anytime that there's a reportable disease that occurs at a childcare agency, measles, mumps, pertussis, these records become important for responding to and controlling spread of disease in these settings, in these high-risk congregate settings. Having vaccination records that we can access is important for timely response and control and preventing further spread of these diseases in childcare settings. I do want to note that individual level information does not get transmitted to the Department of Health and Human Services. The records are retained at the child care agency, but we have the ability to go in and look at these records to ensure accurate documentation and to use them in the event that a disease or an outbreak is occurring at a child care agency. And so just in summary, let me say that I think House Bill 1213 we're against House Bill 1213 because we believe the policy is going to, or the proposed policy is going to directly impact vaccination rates, and high immunization levels is important not only for protecting the individual, but also protecting other children at the child care agency, particularly children that may not be able to be vaccinated yet or have a contraindication, medical contraindication of vaccine. It's important for protecting the families, keeping the kids in childcare, keeping the parents at work. And I would argue it's important for protecting the childcare agency itself and its operation and making sure that the childcare setting is safe and healthy and can remain open and operational. Let me end there and thank you for your time and happy to take questions.
Thank you, Doctor.
Uh,
I know.
Oh, I thought.
Senator.
You had it right there. Good morning, Senator Berzel, and thank you. Good morning, Dr. Chan. Thank you for taking my question. And I probably should have asked this of Representative Berry when he was testifying. It just, takes me sometimes a few minutes to acclimate. So the introduction said this doesn't do anything except change the paperwork requirement. But in looking at the current statute and obviously looking at what's proposed, there's definitely a strikeout. It's not even just the word optional. There's a strikeout of childcare agency, public or private, unless the following is demonstrated. So I'm just trying to get my arms around where, to me, it does look like this is eliminating the requirement. So can you help me to understand?
Yeah. Senator
Can you
Prentice.
take me there? And I should have asked Representative Berry, and I will follow up with him, but I just was.
Thank you for asking that. I think this was one of the sources of confusion when this bill was heard over in the House. There was disagreement on this point, and afterwards, after the public hearing, the bill was amended. Hence the amended analysis that clearly states this bill removes the immunization requirements for childcare agencies. So that this has been our concern in past hearings, and I think the amended analysis in fact shows that this bill would remove immunization requirements for childcare agencies.
Thank you. So, Dr. Chan, have you or any member of your staff spoken with the bill sponsors or even Representative Berry that came in today to see if there is some type of misunderstanding, or what is?
I have not personally had direct contact with the representative about his testimony, but I think when we last interacted over this, it was before that amended analysis to the bill. And so I'm a little bit surprised to hear the same thing again in this committee.
I think that with all good, I'll just close with the statement. I think that would be recommended because we're hearing two very different things here, and I'm just wondering what's been missed in the
Right.
middle, and that I think will help answer the question. Thank you, Senator Birdsall. Thank you, Dr. Chan.
Thank you, Madam Chair, and thank you, Doctor. We appreciate you being here and testifying. You just kind of set off some alarm bells with me with the cases of measles and polio. Has the CDC or you identified where the source of this outbreak is coming from?
Yeah, so so two points to be made. Measles was eliminated in the U.S. Over 2 decades ago, and so the majority of time when there are cases, it's reintroduction into the United States from overseas. There have been increases in measles, for example, in Europe, or people traveling for vacation overseas and then coming back to the U.S. and bringing measles back into the United States. That is the introduction of the disease, but what causes subsequent spread and transmission of diseases like measles is under vaccination in our communities here in the United States. So it's not one specific event, it's multiple separate occurrences happening across the U.S.
Thank you.
Thank you.
Yes, thank you. Good morning, members of the committee. My name is Kate Fry. I'm the Vice President of Advocacy at New Futures, and my work legislatively is public health. And
Good morning. My name is Rebecca Wojciechowski, and I'm the Child and Family Policy Coordinator at New Futures.
so you get two of us today because this bill overarches two major issues of which New Futures works on. As you know, we're a nonprofit, nonpartisan organization that advocates, educates, and collaborates to improve the health and wellness of all New Hampshire residents. We oppose 1213, HB 1213. I'll speak initially to the public health concerns. I wholeheartedly agree with Dr. Chan's interpretation of the bill that it does remove the requirement for child care agencies for immunizations for kids to attend child care agencies. It's really important to understand that this will weaken and open the door to the spread of infectious disease, many of that have been eradicated. I'm including an article about a recent outbreak at a child care agencies for measles in Philadelphia. We support public health policy that decrease illness and decrease disease, including a robust immunization program. We support that. HB 1213 is about weakening New Hampshire's very successful childhood vaccination program. Very often, we understand childhood vaccinations is considered to be one of the 10 great public health achievements, but many times with public health, because you don't see the diseases, they've been eradicated, the assumption is that these laws are no longer necessary, and that is just not the case. I just want to underscore that this would impact New Hampshire's immunization rates for children and open the door to diseases that have been eradicated. And then I'll have Rebecca speak to the child care piece.
Great. Good morning, and thank you for hearing my testimony today. So New Futures opposes HB 1213 because of the risks it potentially poses to our child care development block grant. So our Child Care Development Block Grant, as you all know, is our key and only source to help offset the costs of childcare for low-income families. As part of CCDF final rules that have existed for over 10 years, the lead agency, which is DHHS, has to set minimum health and safety standards, which includes age-appropriate immunizations. If this law were to be passed and DHHS could not issue those minimum standards, we would risk that entire block grant. Furthermore, I want to underscore that this does not mean that DHHS has to mandate all kids in childcare receive immunizations. The CCDF final rules clearly and explicitly protect parental choice and the right to exemption for religious reasons or medical reasons. I also want to underscore that over the past number of years, the reporting requirements have become easier given the fact that there are e-charts and forms your doctors can send out. And want to say that I understand administrative burden for childcare centers, but this is the incorrect forum to address those issues. Those issues should be addressed through childcare licensing to figure out a way to make reporting easier. We shouldn't be looking to remove all immunization requirements as a whole. With that, I'm happy to answer any questions, but thank you for hearing our testimony.
Thank you, and thank you for your testimony. Maybe I wasn't listening, and that happens from time to time. But when I heard the testimony in the beginning, I'm trying to reconcile the cost of insurance. That was brought up, and I'm trying to reconcile with that with this bill. And how is this making it so that childcare is unaffordable, or the centers can't afford to stay in operation? Was I listening correctly?
So that's what I heard as well. Rebecca was not here
Thank
for
you.
that part of it, and I don't understand why that would be the case. If someone wants to provide us more information, I'm sure Rebecca can address that.
So, I wasn't here for that testimony, but I can say that I would assume that risk would be greater for childcare centers if they didn't have standard immunization practices, because the risk of exposure for a child and then your exposure to tort liability in court exists absent those. I can't speak to what the previous individual said, but I was a former litigator, and I can say that, having standard health practices that ensure kids in close care is going to reduce your liability, not increase your liability.
Thank you, Madam Chair, and thanks for taking my question. So I want to go back to what you had mentioned about the Child Care Scholarship Program. You worked with this legislature to expand eligibility for the Child Care Scholarship Program. We have a child care crisis in New Hampshire. It is still the case that families cannot find affordable childcare. Even if they can find it, it's not affordable for some families. So this legislature has worked very, very hard to expand access to support our centers. So I just want to clarify what you were saying, that this bill could potentially put at risk all of the federal dollars to support what this legislature did in the last budget cycle.
Yes, and I'll let the department speak more to that, but it's pretty clear that the CCDF final rules require the lead agency to set minimum health and safety standards for childcare centers that are receiving CCDF funds. So there are probably childcare centers out there that may not receive any, but that is the core way which we have sustained and stabilized childcare for New Hampshire families. So given that risk here, and it's clear that there is one, we oppose the bill.
How much does New Hampshire get from the block grant for the Child Care Scholarship Program?
I don't know the number off the top of my head, but I believe it's over 20 million.
Over 20 million?
Yes.
Any other questions? I do have one question. So what you just said regarding the, what would cause, if these daycare centers are already providing the information on immunizations, why would certain childcare facilities, their insurance triple?
I wasn't here for that conversation, so I can't answer that question, and I don't know why that would happen.
All right, I will try and find out. Thank you. Any other questions from the committee? Welcome.
Thank you. Good morning. Karen Hebert. I'm the Director for the Division of Economic Stability at DHHS.
And Brian Clark, I'm General Counsel for the Division of Economic Stability.
So I will echo what our partners from New Futures have stated here today, that the department is recognized as the lead agency for the Child Care and Development Fund block grant. We currently are receiving approximately $27 million from this particular federal fund. And that includes the funding to support the Child Care Scholarship, which is a child care subsidy program to increase access for families who have low incomes that need child care assistance. One of the provisions that we are required to follow to receive this particular funding includes a number of health and safety implementations and enforcements of health and safety provisions in that regulation. That includes that we have to ensure that children receiving services who are receiving the child care assistance funding are age appropriately immunized. And we are required to report on that to the federal government, and that information must be available. So we would absolutely be at risk, if this bill passes, of losing that $27 million a year. Do you have anything to add?
Ditto?
Nothing to add. Thank you.
I'll ask my question from the previous question. So we heard from one of the co-sponsors that a daycare provider had to pay 3 times, their insurance rate went up 3 times. And even though they are obviously following the requirement, do we know why?
The direct connection is not exactly clear to me either. However, I know that there are child care programs who are struggling with trying to obtain or keep liability insurance. They're not required by state law to have insurance. However, there are a number of programs that have experienced losing their insurance for a multitude of reasons I can't name off the top of my head, but how that is associated with the record keeping issue, it's not really clear to me. I don't know what the insurance companies would ultimately be requiring.
Any questions from the committee? Seeing none, thank you.
Right, thank you.
I have an Ann Stark here, private citizen, but you in support, but not. Did you want to speak at all? Okay, thank you. Laura Condon.
Thank you. Good morning, Chairwoman Bertzel and members of the HHS committee. I am Laura Condon. I'm from Bedford, New Hampshire. I'm a volunteer New Hampshire Director of Advocacy for the National Vaccine Information Center. I'm here today to testify in support of House Bill 1213 relative to immunization requirements for child care agencies. Please be clear, this bill makes no vaccination requirements for public school children, nor does it remove any requirements. This bill will make childcare more affordable and more accessible, and there is no grant money put at risk. I urge you to request a copy of those federal requirements. If it's anything like the federal requirements for foster care families, perhaps you're being misled about what the requirements truly are. What this bill does is it removes certain reporting burdens on some child care agencies, period. It's a great bill to remove costly and unnecessary administrative burdens that cause stress for staff and parents and take precious time from limited staff to chase down records and file reports when their time and attention should be spent caring for children. I wish to point out the separate immunization requirement provision, the enforcement provision, and the exemption provisions in state statute. The immunization requirement provision is RSA 141C20A, Roman numeral 1, and it requires all parents or legal guardians shall have their children who are residing in the state immunized against certain diseases. These diseases shall include, but not be limited to, diphtheria, mumps, pertussis, poliomyelitis, rubella, rubiola, and tetanus. The commissioner shall adopt rules under RSA 541A relative to other diseases which require immunization. You'll note in the immunization requirement statute, there's no mention at all about daycares or schools. That's because this is a very broad requirement on all children residing in the state. That statute is not impacted by this bill. Then there's in the enforcement provision in law, which is RSA 141C20A, Roman numeral 2, that requires that no child shall be admitted or enrolled in any school or child care agency, public or private, unless the following is demonstrated: immunization or partial immunization or exemptions. Please note here, this provision is using schools and daycare agencies as an enforcement mechanism for the very broad immunization requirement I just read. Please do not confuse the requirement with this limited immunization mechanism. The two are very different. The requirements still stand on all children in the state. Then there are the exemption provisions, which are RSA 141C20C, and it provides that a child should be exempt from immunization if a physician provides that exemption. I'm paraphrasing here. Or Roman numeral 2, a parent or legal guardian objects to immunization because of religious beliefs. The parent or legal guardian shall sign a form that the child has not been immunized because of religious beliefs. Please note, this exemption provision is a separate section of RSA 141C20 and is broadly stated. There is nothing in this provision that ties it to schools or daycares. It applies to all children in the state, whether they are in a public school, a private school, a daycare, no school or daycare, or wherever there is an attempt at the immunization enforcement provision. While school and daycare enforcement provisions refer to this separate exemption section, it is redundant because this exemption provision is broad and it refers to a child without limiting the exemption to only certain children in schools or daycares. Again, it is a very broad exemption provision protecting all children in the state. So you may hear misinformation that the bill changes current immunization requirements. Please direct them to the immunization requirement provision that I just read, RSA 141C20A. Nothing in this bill changes these state immunization requirements. It's untouched. You may hear hype and hysteria that people will suddenly stop vaccinating and suddenly there will be outbreaks of diseases that will cost lots of money. Please don't fall for this hype and hysteria. There is no evidence that making this minor change to remove the reporting requirement for child care agencies will do anything to change vaccination rates. The evidence is published by the New Hampshire Vaccine Association that 76% of the vaccines that DHHS purchase is for vaccines that are not required by state statute. And parents are voluntarily getting all those shots, including those for flu, rotavirus, pneumococcal illness, hepatitis A, HPV, and various meningococcal illnesses. The evidence is that the largest driver of vaccination rates of all types of vaccines, required or not, is a pediatric practice, not enforcement mechanisms. Any hype relative to measles outbreak focuses on the cost, largely tied to government response and overreaction, not medical treatment. The evidence shows that well-nourished children who have measles in a first world nation such as the United States have a mild illness that is self-limiting, requires no specific medical intervention, and actually confers lifelong immunity. Those who fear measles can take the risk with the shots. We all want healthy child care environments that are clean and welcoming of all healthy children, vaccinated or not. If you're sick, stay home. It is unkind and divisive to make any claims that a child who has not had a vaccine would create an unhealthy environment. Clean, healthy children are not threats. Vaccines are readily available and usually without cost to anyone who wants them. It is hype and hysteria to make claims that few children who are not vaccinated will put anyone in the community at risk. You may get shots for yourself, and if they work, you are protected. Again, this simple bill only removes certain burdensome reporting requirements. I hope this bill will have your full support, and I'm happy to take any questions. Thank you.
Thank you, Laura, Madam Chair, thank you. Anyway, can you just show me where the direct link between this bill and lowering the cost of insurance is? Because I'm still having a hard time reconciling that.
Yeah, I'm not familiar with the insurance problem. But, you know, obviously if, you know, insurance companies are saying that, you know, you're in some sort of violation, it could impact your insurance rates, but it's not an area I'm familiar with. Yeah.
Good morning. So, looking at your testimony, I'm going to read back what you said.
Sure.
This bill makes no vaccination requirements children, nor does it remove any requirements.
Right.
This bill does not change or remove any exemptions to vaccine requirements. So, looking at the statute, 141C20A, which you correctly note is the requirement, which isn't being changed here. My question to you is, if the requirement stays in place, but there's no reporting of the requirement, doesn't that eviscerate the requirement? Because who's going to report if they don't have to report? And how can it be enforced? Hence, no requirement.
So if I can understand you correctly, so are you saying that there's no vaccination requirements on children in New Hampshire, notwithstanding the statutory language, for those children outside of schools and daycares?
You didn't, if I could follow up.
Sure.
You haven't answered my question. If you undermine the reporting requirements by making them optional, which is what the legislation does and what your testimony says, how then is the first section of that law to be enforced? And my question is then, why is it a requirement if you can't enforce it? How is it a requirement?
It's still enforceable at the school level? Right.
So no requirement, basically.
It removes the reporting requirement. It doesn't,
No reporting, in my opinion, equals no requirement.
it's not what the statute says, but
It's what the bill says.
thank you. I appreciate the conversation.
Okay.
Any other questions from the committee? Seeing none, thank you.
Thank you.
Jerry Knirk?
Thank you very much. For the record, my name is Jerry Knirk, and I'm a retired surgeon and also retired from the New Hampshire House of Representatives. So we had a lot of discussion of this, but that HB 1213 is just repealing a record-keeping requirement, but by doing so, it does repeal the requirement. And I think Senator Bradley just hit the nail right on the head, that if you don't have some mechanism of enforcement, it doesn't exist. If you look at the language of the current statute, it says, unless the following is demonstrated, immunization under paragraph 1. How do you demonstrate it? You demonstrate it with documentation. Think of a bar. We say you can't go drink if you're under 21. If you look young, you have to show an ID, right? Well, if we say, yeah, no, you don't have to show an ID, we have effectively removed the requirement that you have to be 21 because you just walk in. I think that's a good analogy. And the reason that these immunizations are required to attend childcare is that childcare is an incredibly effective setting for the transmission of communicable diseases, especially respiratory diseases, and any parent in this room can vouch for this. This bill will increase the number of unvaccinated children in childcare settings, putting children in communities at increased risk of vaccine-preventable diseases that can lead to disability and death. Regarding the insurance, I'm not an expert on insurance, but as a surgeon, I got to play with liability insurance one heck of a lot. And insurers insure against risk. And how do they know what the risk is? Well, one of the aspects of risk is how compliant is their client with either requirements, or even if it's not a requirement, with good practice. So I would think it's pretty clear that if they find out that the child care agency is not reporting information about vaccine requirements, that they may not be enforcing them. And if they don't enforce them, they're at increased risk, because if you get an outbreak of measles or polio in a child care setting, because they were not requiring vaccination, which is the proper thing to do, they're going to open themselves to a lot of liability. And I think that's pretty much straightforward why they crank up the rates. You do the wrong thing, your rates are going to go up because you increase risk. The bottom line is vaccination is one of the most important public health things we ever had in the history of the world. If you've ever gone into any of the cemeteries around, our nice old cemeteries, looked at those tombstones, 19th century, and you see all these families where a whole bunch of kids died in 1 month at one time. Those are infectious diseases that we don't have now because of vaccination. And polio is a great example. Many of you in this room are a little bit young to remember the fear of the polio epidemic, but you probably heard about it. And I had the privilege of caring for some patients with polio, one of which is a guy precisely my age who happened to get polio. I did not. And he was left with paralytic scoliosis, and after several operations still walked all bent over and crooked and in pain. And I took his spine apart and put it back together in a 22-hour operation. And I thought it could have been me. And we still see polio around the world, Afghanistan and Pakistan. We will be at risk if our vaccination rates drop. We've seen measles outbreaks as the vaccination rate drops. Now, here's the point. One can argue, well, a parent gets to make this decision because it's for their kid, right? No, because what they do with their kid affects other kids. It's a decision that affects other children. Their unvaccinated child may infect a vulnerable child. By vulnerable child, I mean those who are medically unable to be vaccinated, or where they may not be able to mount a good response to a vaccine because they're immunosuppressed, or they're too young to be vaccinated. An unvaccinated child in a child care setting will be placing those vulnerable children at risk. In addition, no vaccine is 100% effective, so you're even going to be putting at risk some vaccinated kids who just never mounted a good response. The decrease in the vaccinated children will decrease their herd immunity, and that needs to be sufficiently high to prevent spread, both in the child care and in the community. And we've seen that again with these measles outbreaks, where rates only dropped as low as sometimes 85% in the community. Measles requires about a 95% outbreak because it's highly contagious. Rubella really offers a unique and different and more serious risk. An unvaccinated child with rubella in a child care setting can give it to a fellow student, who then takes it home to his mother, who just happens to be pregnant. And then you can have congenital rubella with defects such as deafness, cataracts, heart disease, and mental retardation in their developing sibling. So that impact goes a long way beyond just their child. And that infected student can also infect a pregnant teacher or other school staff with the same disastrous consequences. And another one, Senator Whitley commented about the economic issues in childcare. There are economic issues. Put yourself in the position of a parent of a vulnerable child, someone who has an immunosuppression of some sort, either from an illness or treatment, or has a disease that precludes them from being vaccinated. So what are they going to do? Let's say the only child care facility in a reasonable range for them happens to be one that doesn't require vaccination. Well, do they face an interesting Sophie's choice? Do they place their child at increased risk by enrolling them in that facility? If they don't, they can't go to work. And we have workforce problems because parents can't find childcare. The comment about if you're sick, stay home doesn't work because a lot of illnesses are transmissible prior to showing symptoms. Point is, religious and medical exemptions already exist in statute. Parents are not forced to vaccinate as long as they don't enroll them in childcare. Yes, the immunization statute exists, they're supposed to, but as Senator Bradley points out, there's really the enforcement point is when you enter school or childcare. If they're not, if they want to go live in a cave somewhere, that's fine. They don't have to vaccinate them. The point is, it's bad public health policy. It takes us either to a third world status or back to the 18th or 19th century. This bill definitely should be ITL'd. Thank you.
Thank you, Representative Senator Ibarra.
Thank you, and I appreciate your testimony. And I don't know how to word this, but, you know, we've had about 8 million to about 12 million, depending upon how you want to describe it, illegal aliens or immigrants that have come into our nation. And we have no way of tracking whether they have been immunized or vaccinated in any way. I can't help but think that some of them are coming into our daycare centers. So if we adopt this bill, we'd have no way of protecting the children here already, correct?
That is correct, and even more so. People travel. With the recent outbreak of polio that occurred in New York in 2022, if I recall, was I think, if I recall, was a person traveling, not an immigrant. People travel, you know, remember there's all kinds of vaccinations you're supposed to get if you travel to certain areas that we don't usually have to worry about. But in general, travel. Millions of people travel to all areas of the world. It's not just the number of people crossing in who might carry a disease. But you're right. This is how we protect, because indeed, measles eradicated in the country. How to come here? Back again. Maybe it doesn't just spontaneously come out of the ground. Because somebody travels in with it, we have a low herd immunity, bang, we got an outbreak. Polio, same thing. And so you have endemic countries, Afghanistan and Pakistan, and you have other countries where polio is sometimes seen, again, primarily because of importation of polio virus from an endemic area, and that is a problem, and that can happen to us.
Thank you.
And yes, I see you looking at your watch, I'll answer, I'll stop.
I have a prime bill. Any other questions from the committee? Seeing none.
Thank you.
Thank you. Stacy Neville.
Thank you so much. My name is Stacy Neville. I'm the Vice President of Operations at the Granite YMCA, headquartered in Manchester with about 30 childcare locations spread out throughout the state. And I'm here today speaking on behalf of all of the YMCAs in New Hampshire in strong opposition of House Bill 1213. Collectively, the 8 YMCAs in New Hampshire are one of the largest youth organizations in the state. We serve thousands of children in our early childhood programs before and after school and summer camps. These programs provide children with safe, nurturing, and enriching care and a critical component of our state's infrastructure to support working families. Nothing's more important than the safety of the children in our care. This bill would eliminate, in my opinion on reading it, immunization requirements and tracking for child care programs. Immunization requirements help protect the health and safety of the children and also of the staff that run those programs, and help us provide continuity of programming so that parents can work by reducing the likelihood of classroom closures due to an outbreak of a communicable disease. We understand that some supporters have claimed that the bill would reduce the administrative burden on child cares. In fact, it would make program operations much more difficult and cause undue strain on parents that need safe, reliable child care in order to participate in the workforce. I'll also add, as one of those people who has to do all of the paperwork requirements, we're perfectly fine with continuing to do that. It's not that much of a burden or a lift to continue reporting on those immunizations.
Thank you for your testimony. Questions from the committee? Do you see any link to the cost of insurance? Do you see anything?
No, so I believe, as someone who runs program, I believe what he was referring to is because it is in writing that we can get violated if somebody comes and does an observation with us and you don't have immunization records for somebody or something on file, just like all other administrative paperwork that's in licensing requirement, you could get documented for that and it shows up on your record. And I assume he was referring to the fact that then your insurance company could look at that and say, you had 3 or 4 violations this year, we can up your insurance. That's the correlation I believe he was making to that, because anything that you get documented on your thing could be used kind of against you in a lot of different ways. But again, not keeping track of those things, I believe would be an even bigger liability on our insurance.
Thank you. Seeing no further questions, thank you very much for your testimony.
Thank you.
Christine? From Citizens Little Sprouts? And it's Treyer?
Yes, trainer.
Treyer.
Yes. And this is Errol Warden. She's with me as well. I didn't sign her in.
Could I
So-
interrupt you just one
Yeah.
second? Folks, if you're having a conversation, we're having a hard time keeping track, so some of us, if you just take your conversation outside, we'd really appreciate it. And I really apologize. You can start all over again.
So I'm Christine Trainer. I'm with Little Sprouts. We operate 3 different childcare centers here in New Hampshire. I'm also a resident. We have 36 other locations across several different New England states. And I will echo, my testimony is going to echo what DHHS already said, and also our friends from New Futures. We're in opposition of this bill because it does put into danger our eligibility and access to the child care block grant funds, as cited already. It also opens us up to further liability issues, and this not having this bill would help protect us. And thank you for hearing my testimony.
I'm mostly here to answer the question around the insurances aspect. Is he, just like she spoke to prior, he seemed to be making a correlation between you can get flagged if you're not doing the paperwork requirements for insurance. There has been, as far as I'm aware, there has been no cases of this particularly flagging that. And we've been in conversations with insurance companies that do cover childcare centers, and the biggest thing is liability for them. So if anything, this is going to make it more of a struggle for childcare centers to get coverage and insurance. So I think there's a bit of a leap for him.
Questions from the committee? All right, I do, if you don't. So you have 36 facilities, therefore you probably have to apply for some of these block grants?
Correct.
And in the requirements for that block grant, does it say that you have to have certain specifications that this bill would interrupt?
It's more around the reporting.
It is.
Yes.
So if you do not report, you do not get the block grant.
Yes.
That's a fact.
As far as I know, yes.
If you could send the committee that, because there seems to be a conflict between what a previous testimony and your testimony, but we don't want to jeopardize that. So if you could, that would be very helpful.
Okay.
Yeah, if you could say, hey, so this is where it says that, that'd be great.
I'll have to go and check with some of our other departments to
Thank you.
find the verification for that.
I appreciate that. Thank you for your testimony. And seeing no further questions, and I don't have anybody else wanting to testify, I see a hand. Welcome. Did you sign up?
I'm sorry. Representative Yuri Polzov representing Merrimack 10, Hooksett Dunbarton. I want to briefly testify in support of this bill. I'm a member of House Health, Human Services and Elderly Affairs Committee. We thoroughly discussed this bill. And the House came to a bipartisan compromise to present you with this version that is focused on child care agencies. So second, administration burden is not huge for large networks like you heard from YMCA, but for smaller businesses and very small childcare agencies, administration burden is much harder. That's why it's important. And finally, in my private capacity, I work in the cybersecurity industry, and even large healthcare facilities struggle to keep personal healthcare information secure. So when the state requires the smallest childcare agencies to keep personal healthcare information, it's overreach and it puts this information on families at risk. So please support this bill.
And I have nobody else.
Senator Avard, could either Dr. Chan or someone from HHS come up again? I want to ask about that federal block grant requirement that you were just trying to get the language for. I'm wondering if they can help us.
Can anybody help us?
It's just a matter of getting a copy. What is the question?
Can we, Abby, can you? Your insurance. Yeah.
Hi, Abby Rogers, Legislative Liaison for DPHS.
Well,
So, thank you.
and
So, thank you. And Senator Avard had asked the
about the block
two
grant.
women from the, I'm sorry, I did.
From
I'm
New
trying to write
Futures.
down all the names as they come forward, but.
Sure.
So looking for the specific language, the requirement that would make this problematic, where they wouldn't be eligible to get those dollars. Can the department point to that?
Yes, if I could send it to you offline, I'd be happy to do that because I do have that in my text.
I
It's
think
a, it's a
that's
federal regulation and a number that I can send to you.
All right.
That would be very helpful, and thank
Okay.
you. I appreciate
Of
it.
course. Thank you.
All right.
Okay.
Wow, we're losing our folks here. All right, so with that, I guess we're going to close the hearing on this. I don't see anybody else signed up to speak on this, so we will close the hearing. And I got the thumbs up. The boss says I can do this. All right. We'll hear from the prime sponsor of 1194. That's HB 1194. Do I have a taker? You don't look like
Thank
Rep. Phillips.
I am not. I'm not the prime sponsor, but she's not able to join us today. That's why there are other stand-ins for her. I am, however, a co-sponsor. So for the record, I am Representative Erica Leon, representing the town of Derry, and Vice Chairman of the Health and Human Services Committee, and a co-sponsor on this bill. This bill is actually quite simple. The whole idea of vaccination for public health is to stop the spread of communicable diseases. Many infectious diseases are communicable, but not all infectious diseases are communicable. When you look to some of, so in order to make sure that we have precise language, we make sure that we don't have language that has people concerned about a creeping scope of our vaccine requirements. And to be precise, it's important to remove infectious, because if something is both infectious and communicable, it is fully covered by the statute. However, for those diseases which are not communicable, like H. pylori, you get to the point of should we be requiring a vaccine for something that is infectious but not communicable? I know it sounds like splitting hairs, but pulling up a publication from the Lancet, which is one of the major medical publications from over in England, they were discussing the impact of burden of health from infectious diseases that are not communicable. There's analysis that suggests that about 30% of new cancer cases can be attributed to infection in sub-Saharan Africa. However, that proportion is as low as 4% in North America. And some of the non-communicable diseases with high rates in low and middle income countries, such as rheumatic heart disease and cervical cancer, can be fully attributed to infection. So, I mean, would we want to have a vaccine against strep throat because it can lead to rheumatic fever? And what would be the risk? What would be the cause? And if we did have one, actually strep throat is communicable, so that actually would not fall within that. But when you're looking to H. pylori or any of these, let's just look to have our language clear. If it's communicable, just like strep throat would be, leading to rheumatic fever, then there's a case for it. And but if it's only infectious but is not communicable, then there isn't. So I think that it's important to have our language clear and precise. And I think that as we work on rebuilding our communication and rebuilding some of the trust that was stretched during the last several years. I think it's important to make sure that people aren't concerned that we're going to be bringing in cancer vaccines and bringing in any of these new therapies, because when you look at it, some of the immunotherapies are essentially vaccines. However, on an individualized basis, it makes a lot of sense to do it because the risk and the reward for that individual is there. Unless there is a public health benefit, there's no argument for required vaccination. So let's let the scientists convince people that if they do want to get some sort of vaccine for cancer, that's a great idea for them. But let's not push it on people and then bring another area where we're going to be arguing about whether or not that's appropriate use of government. So I know this is a nuanced sort of bill, but I think it's quite important.
Thank
So
you for your
thank you.
testimony, Senator. So you have is tetanus an exception in this language?
Tetanus is an exception in this
Why is
language. Because tetanus is not something you get from another person. Tetanus is something you get from stepping on a rusty nail and not having appropriate wound drainage. It's something where you look to this and it's one of those things that at this point is an accepted vaccine that a lot of people agree with. And trying to look at that and trying to say that we're not going to include tetanus as one of the required vaccines means that this bill would quite frankly be dead on arrival. And I think that clarifying the language while keeping tetanus in there makes sense.
And processing. Thank you. No further
Okay.
questions.
And you know how to reach me if you have further questions.
You got it.
So thank you.
Okay, so Dr. Chan? Welcome back.
Great, good morning. Mr. Chair and members of the committee, thanks for hearing testimony on House Bill 1194. Again, my name is Ben Chan. I am the state epidemiologist and also an infectious disease physician. And hopefully my brief testimony will help answer the question that you just asked about, why is tetanus an exception? Let me first start off by saying that we are not expressly taking a position on this bill, but we wanted to raise a couple of significant concerns that we have for the committee's consideration.
So can I get you as opposed so I can mark you as neutral?
If we had to take a position, it would be on the opposition side, but in our testimony, we're not stating that we're opposed. So you can mark us as neutral, I believe.
Okay,
Yeah.
thank you.
We were opposed to a prior version of this bill when it was heard in the House side, primarily because of the tetanus issue. And the concern there was that tetanus is not transmitted person to person, as you just heard. It's acquired from the environment. But the tetanus vaccine only occurs as a standalone vaccine with other vaccines, specifically diphtheria and pertussis, which are also required vaccines. And so the concern was that this would prevent requiring not only tetanus, but also these other vaccines because they occur as a combination vaccine. That's the only specific disease that for which there's a required vaccine that is not transmitted person to person. With that being removed as an exception from the bill, hence our change in position to one of a more neutral position, but we still have some concerns, specifically that it creates potential confusion and conflicts with other areas of RSA 141C, while ultimately not changing current vaccine requirements. Specifically, it conflicts with the already established definition of what is a communicable disease that's outlined in RSA 141C2, which defines communicable disease as, and this is an abbreviated version of a longer definition that's there, but RSA 141C2 defines communicable disease as illness due to a microorganism, virus, infectious substance, which may be transmitted directly or indirectly to any person from an infected person, animal, or arthropod, or through the vehicle of an intermediate host, vector, or inanimate environment. So the proposed definition change of non-communicable disease in House Bill 1194 would potentially, actually conflicts with this broader definition in RSA 141C would potentially create confusion and conflict within the legislation, the broader legislation, and the impacts of that are unclear. So I just wanted to bring that to your attention for consideration. It's not clear how that conflict would play out. We also believe that the legislation is unnecessary because other than the tetanus vaccine, we don't require vaccines for diseases that are not highly infectious and able to be transmitted person to person. And so this wouldn't actually change current vaccine requirements, but may limit future flexibility if new vaccine combinations specifically come up that might be important for public health protection. Again, I just want to be clear, there's no plans or discussions about adding any new vaccines to the requirement list. It's simply an issue of future flexibility. So those are our two main concerns. One is that it conflicts with the already established definition of communicable diseases. And second, that we believe it's unnecessary because it doesn't actually change current requirements. Thank you. Happy to take questions.
Senator?
Thank you, Dr. Chan, for taking my question. I think you just wrapped with it. Is it your position that this is unnecessary?
Correct.
Okay, thank you. Well-intentioned, maybe, but unnecessary.
And I'll also add that, we believe that the way it's worded currently is more clear and accurate and consistent with the broader legislation.
Okay.
Just one question. So is an inanimate environment, would that be like a rusty nail?
Correct. Yep.
So good.
Thank you.
Thank you.
All right. So that's the next one. Who's the first guest? So I see this. I figured I'd have you go first.
Kate Free.
Good morning again. My name is Kate Fry, Vice President of Advocacy at New Futures. I'll be very brief. We oppose HB 1194, and really on the basis that we just feel it's unnecessary. We feel like it creates tremendous confusion and conflict. The previous hearing was a good example of, when you have a bill that's not quite clear, there are two very strong opinions. And so why create more confusion around a really important statute? So we oppose this bill.
Any questions from the committee? Seeing none, thank you. Laura?
Good morning, Chairwoman Birdsell and remaining members of the HHS committee member. I am Laura Condon from Bedford, New Hampshire. I'm a volunteer New Hampshire Director of Advocacy with the National Vaccine Information Center. I'm here today to testify in support of House Bill 1194 relative to the definition of non-communicable disease. This is a simple bill to make a technical correction to the definition of non-infectious disease for purposes of mandating vaccination for children. It was an error in the original bill to include non-infectious along with not transmissible, and the definition of non-communicable in this error should be corrected. If vaccines without risk of harm or failure, there would be no need to mandate them. Because there is risk, we must be very careful to only require vaccination for that which is truly necessary to prevent disease spread in the community. The 1905 U.S. Supreme Court case, Jacobson versus Massachusetts, permits compulsory vaccination laws with exemptions and a $5 fine, where there is a compelling state interest to protect public safety. This court decision focused on smallpox, which was both infectious and transmissible. If a disease is infectious but not transmissible, it does not spread from person to person, and there's no compelling state interest in protecting public safety. Please be aware that there are now over 70 doses of vaccines that are now recommended for children from birth to age 18. There are dozens more vaccines in the pipeline. Most of them now are mRNA shots, which have shown great evidence of both harm and failure, as we've seen with the COVID mRNA shots. We must be very careful what we mandate for children. There is a carve-out to allow the tetanus vaccination requirement to remain for children. This is not a standalone vaccine. It is part of a vaccine cocktail with at least 2 other vaccines. Some things you should know about tetanus. Tetanus bacteria is ubiquitous. It's everywhere, not just on rusty nails. Tetanus illness is extremely rare. We cannot test for tetanus. It's a diagnosis of elimination. The mortality rate for tetanus is very low. Tetanus occurs most often in the elderly, very ill, with severe chronic illness, often institutionalized patients. But even then, the survival rate is very high. The vast majority of adults are not current with tetanus shots, and there are not mass outbreaks of tetanus. But again, this bill still keeps the requirement for tetanus shots. There will be those who hype disease such as malaria or Lyme, spread by insect vectors, but not human to human. While we may use poisons to kill those insects, we cannot impose vaccine mandates on people when people are not the vectors. Should there be development of vaccines for such illnesses, they will be available to those who want them. But again, this would have no impact on community spread because these diseases are not spread person to person. In light of the very aggressive push to bring more and more vaccines to market, injections that may now include mRNA shots that bring new serious known and unknown risks of harm, now is the time to correct this error in the statutory definition to ensure that the power of the state is properly limited to protecting public safety. I hope this bill has your support. Happy to take any questions. Thank you.
Thank you, Laura. Any questions from the committee?
Thank you.
Representative Horgan?
So I'm Representative Timothy Horgan from Stratford County District 10, which is the town of Durham, and I certainly don't pretend to be an immunologist. And even if I was, I couldn't have said what I couldn't have said what Dr. Chan said any better than he did. So he definitely, I hate to use the word nail because we had all this strange discussion about rusting nails, but he definitely addressed the issue perfectly, so even I could understand it. So the part about adding tetanus that's probably not a bad idea. Certainly the rest of this bill is just language that's been unchanged since 2017, and frankly, I don't specifically remember the bill that I must have passed while I was still in the legislature in 2017. But so I don't see what the purpose of crossing out the words infectious or. So I think it should be, that piece of the law should be the same as it is, possibly with tetanus added. That's a good idea. So one thing, and there are a number of infectious diseases that aren't necessarily transmitted person to person. We've heard about malaria and Lyme. Those have non-human hosts. And there's also others that sometimes are spread directly from person to person or from animal to person, such as COVID, which is still a matter of concern. It's not over. The pandemic's not over yet. Just one thing I can add, which nobody else has mentioned, the larger context for this is, first of all, this is a bill about immunization before you can enter any school or child care agency. And of course, any school, it's not just public schools, it also includes private schools. It presumably would also include schools being paid for with the school voucher program even. And it could in some cases apply to schools that are out of state. So it's that, and also, but there is a clause in this RSA, there's RSA one, it modifies RSA 141C20A, and I took a chance to I looked through, and RSA, it refers to another thing, which I believe is RSA 141-C/22, which allows parents to get a exemption if they really feel they need one. So I just think this, aside from adding tetanus, this bill is unnecessary, and so I think the existing law the existing law is adequate. And I'll often ask, vaccines aren't perfect. Some of them are dangerous, but especially in the case of the COVID vaccine, even the most lurid stories about how terrible it is are nothing compared to what the respiratory virus did, which killed over 1.1 million people just in the U.S. and many millions more worldwide. So I urge you either to ITL this bill or at least ITL it with taking out the strikeout in the second sentence of RSA 141C20A subparagraph 3. So thanks.
Thank you, Representative. Any questions? No?
Questions, but I doubt I could answer them. Thanks.
Thank you. Representative Yuri Polozov. Welcome.
Good morning, Madam Chair. Representative Yuri Polozov, Merrimack 10, Hooksett Dunbarton. I think this bill is a good compromise in the House. Many were concerned around messaging around tetanus, so that's why it's in the bill. It is my belief that we need to be more precise with our definitions. There's an effort to dilute definition of vaccine. For example, in doctors' offices, sometimes antibodies are called vaccine. But we need to come back to proper definitions. That's why this bill is important for proper definition on what's the purpose of vaccination and what is non-communicable. If it's infectious but not transmissible from person to person, there's no need to require. So please support this bill.
Thank you. Any questions? All right. Jerry Kinnerk, welcome.
Sorry, for the record, Jerry Kinnerk, retired surgeon and also retired from the House. And I do not have any written testimony. I had not planned to testify in this, but decided I would add a little bit. Dr. Chan pointed out very well the conflict with other existing statutory language. But I would like to point out that the definition of non-communicable in HB 1194 by itself is vague and scientifically incomplete. The definition that already exists, as Dr. Chan cited, is excellent. The point is, what is person to person? That's not defined. And we know that many diseases are transmitted person to person, but often through things such as inanimate objects and so on that was already mentioned. I think one of the best examples of a disease that is truly transmitted person to person might be gonorrhea, because there you have direct mucous membrane contact with a gonorrheal chancre and you transmit the disease. That's really person to person. Nobody will quibble that one. But what about respiratory? Somebody could sneeze right straight in your face and you inhale it. Okay, that's a direct person to person. But what about when they've sneezed on their hand, they've handled the ladle in the buffet line, and you're the one right after you handle it, and you reach up and scratch your eye and you inoculate yourself. And that is the transmission by inanimate subjects, materials. We know that viruses and bacteria can live for a very short time on inanimate materials. And that is why respiratory illnesses can be transmitted that way as well. I was a surgeon. Why is it we sterilized our instruments between cases? Why is it we put our methicillin-resistant Staph aureus cases at the end of the day so we could really superbly sterilize? Those are bacteria being transmitted from a person to a person, but through instruments if they were not clean. So another one to think about is fecal-oral transmission is a very common one. Norovirus, E. coli, polio, all of those. And although one might think a little bit about how you could conceivably have a direct contact fecal-oral transmission, it's not something we'd like to think about a whole lot. But Why do we see a sign in the bathroom that says you have to wash your hands if you're an employee because you're going to go out and handle food that then goes to other people? Is that person to person? Of course it's person to person, but it went through that person's food. Polio, again, the older people in here can remember swimming pools being closed down. And although chlorinated swimming pools are probably not going to transmit it, polio is also fecal oral. Transmit through food, can transmit through water, though that was probably not as much an issue as we thought it was in the 50s. In any case, this definition by itself is poorly designed, is not scientifically complete. The one that already exists in statute is. It is sufficient. There's no reason to redefine it here in conflict of an excellent, scientifically accurate definition that already exists. I'll take questions if you wish. Thanks.
Thank you. Any questions? Seeing none?
Thank you.
Thank you. Okay, that is actually our last speaker. I had a question. Melissa White, don't want to speak? Okay. So that would be our last speaker. Is there anyone here that would like to speak but wasn't given the opportunity?
Thank you for taking the testimony. I didn't plan to speak either, but there was some misinformation. I just wanted to make sure people understood, but I think Jerry's cleared up a lot. But
Could you introduce yourself?
oh, I'm sorry. I meant to do that. Jennifer Smith, MD, MPH. So I have had a fair amount of research experience as well as clinical experience with infectious diseases that you wouldn't think of about how they are in fact communicable diseases. And I think removing that language is a mistake. You know, you would have to go before the legislature to add new vaccines, if I understand the statutes correctly. So why do we need to do this? There's no reason. And there was a little misinformation both about cancer and malaria. Cervical cancer is in fact caused by a transmissible virus. And that's really important, but we don't require the human papillomavirus vaccine. We do recommend it strongly before people become sexually active. And malaria is in fact through a vector transmitted from person to person. It is something that does not come from other animals. They have their own malaria parasites. We have our own malaria parasites. So if and when we had a lot of malaria in this country, it might become important if a vaccine was available. It's not. So just let's get this straight. There are lots of infectious things that we don't immunize against, but maybe in the future there'd be a reason to do so. And I don't see a good reason to be removing this language and changing it to something else. Thank you.
Thank you. Any questions from the committee? Seeing none? Thank you. Are you Teresa?
I am Therese Bastarash. I'm here to support this change in language and clarification. I'm here to, I support what Laura Condon articulated as well, but my experience with the general public is they go to the doctor's office or being a school nurse and they see what is required and they just, you know, they're too busy turning laundry around, getting the dishes put away to question that. But even with tetanus, in 2021, we only had 17 cases. It is treatable. It is, you know, very rare that we're even seeing tetanus in today's world, but yet now everyone goes and everyone gets a tetanus shot. Even my husband, who's a mechanic, got one last week, and he's like, because they said it was required, you know, and no one's stopping to really question the risk reward of everything they're putting into their body. They're trusting us as either the government, DHHS, clinicians. You say it's recommended, you say it's required, I'm just going to do it. But then you look at the side effects, and people have reported catastrophic incidences to their body and their body's response to these vaccines. And like Laura said, we now have just this boatload of vaccines we're putting into these little bodies that we never did, if you went back 50, 60 years ago. And we're seeing all kinds of different things manifest that we didn't see 100 years ago in our children. We don't know exactly where it's all coming from, but the more we put man-made chemicals into our body and we're messing with nature, the more apt there is to be issues. So I think defining that when it comes to the DHHS and the government and clinicians saying this is what's required, the general public is depending on us that we have really looked at the numbers to say that this is really imperative that we recommend or that this is required. So I think the language is going to help promote that, more of that. I'm just concerned when you also look at the money involved with each and every one of these vaccines, how much money is generated out of the tetanus shot, and having everyone required to do that versus the number of actual tetanus cases and actual deaths from that, and then the fallout from the tetanus shot. I feel like we really need to start looking at all of that we are responsible as clinicians, as government entities, to vet all of that out and make sure we're pushing forward the right information to the general public, because they're just going to take it for granted that we've done that diligence. And my experience is that we are not doing enough of that. So I would encourage you as legislators to really consider tightening up the language as far as what's required and what's not required. Thank you for your time.
Thank you, Teresa. Any questions from the committee? Seeing none. Okay. Representative Potenza. Welcome.
Thank you. Just for the record, Representative Kelly Potenza, Stratford District 19. Just going to keep it very simple. This is not a controversial bill. This is really a simple definition change that's needed to happen for a long time. It's long overdue. So we do not want to allow the government to require vaccines for conditions that are not transmissible. Vaccines have risks. There needs to be informed consent. And where there is risk, there needs to be choice. That's all I have to say. Thank you.
Thank you, Representative. Any questions from the committee? Seeing none. Anyone else here that would like to speak that wasn't given the opportunity? With that, I will say there are 4 that are supporting and 8 that are opposing the legislation. And with that, I will close the hearing on House Bill 1194. And when Cam is ready, we'll go on to the next one. So we will open the hearing on House Bill 1616 and invite the speaker for this bill, which is Representative Paternal. There she is. Welcome. Paternal, I'm sorry, yep.
Yes, Senator Prentice, you can correct everybody on the pronunciation of my last name. Thank you, Madam Chair, and thank you to the committee. I'm presenting House Bill 1616 for the prime sponsor who could not be here today. The intent of this bill is transparency and parental involvement in protecting the rights of parents in the state of New Hampshire. Last year, the Centers for Medicare and Medicaid, I'm sorry, I forgot to introduce myself. For the record, I'm Katie Peternell, representing Tufton Borough and Wolfboro, Carroll District 6. Go back. Last year, the Centers for Medicare and Medicaid Services issued new regulations regarding school billing for Medicaid services. These regulations were intended to ease the administrative burden on school-based providers to promote their participation. DHHS and the Department of Education have been working with districts to implement these new regulations and are currently writing new rules, so this legislation is timely. It is only required under IEDEA and FERPA that schools obtain written parental consent before Medicaid billing for the first time. After that, they don't need parental consent for billing. These services can include preventive care, behavioral health, physical and occupational therapy, disease management, and even dental care. Parents have the right to know about each service being provided and billed for their child. This bill ensures that parents are kept informed about care being provided to their children at school. Thank you, and if you have any questions, I might be able to answer them, but I'm sure there are others who are better able.
Thank you, Representative. Any questions from the committee? Seeing none.
Thank you.
Representative Horgan.
So I'm Representative Timothy Horgan from Stratford County District 10, the town of Durham. Just like my predecessor, the technical issues might be better left to the other people who've signed up, but I'll just say this bill seems totally unnecessary for me. It modifies two different RSAs. One is in one of the education statutes that's already parental consent is already required to enter on the program. So I don't know whether you need to, I don't know what the purpose is of having all this paperwork for each new diagnostic code that gets in there. I might add, this is a major expense for the school and for the providers who provide the service. So this, to use one of our favorite phrases here, this is a unfunded mandate. And so and then also the definition, the part to add RSA to the main part of it was they're adding the paragraph to RSA 200, I think it's 200:27. It says written parental consent is required. That doesn't cover the case. That doesn't cover the case where parents disagree or where the parent has a guardian rather than a parent, etc. Although that's already covered fairly clearly in RSA 186C, if I memorize that RSA, which is the one that deals with the schools side of the Medicaid program. So I just think this bills serve no purpose. It's just an unnecessary paperwork, an unnecessary cost, and it is, once again, as I said, an unfunded mandate. So I would urge you to ITL it. Thanks.
Thank you, Representative. Any questions from the committee?
Oh, yes, sure.
Yeah, thank you, Representative, for your testimony. You said it's an unfunded mandate, so there's a cost to this?
Yes, there's a large amount of.
I didn't see a fiscal note. That's why I'm asking.
Well, no. Well, sometimes things fall through the crack to require a fiscal note. The fiscal note would probably, in any case, say indeterminable. But there's obviously there's going to be a lot more paper flying back and forth. So every time the program requires a new diagnostic code, they're going to have to go back and get a whole nother authorization from the parent, from whoever the parent or guardian is, whoever the responsible party is. And so just speaking as a layperson, I seems to me the requirement just to get parental authorization for the program, I don't know. So that's just a lot of extra paperwork for each diagnostic code that's part of that program. And so that's my position. Thanks.
Thank you, Representative.
Okay. Aubrey Freeman.
Madam Chair, committee members, Aubrey Friedman. I live in Bridgewater, private citizen. I speak in support of this bill. It's parents' responsibility to supervise the medical care of their children, and that includes every single service, not just a blanket, like has been mentioned, not like a blanket, okay. It's got to be every service, and that's what this bill is all about. Just because the federal government is paying for it is no reason not to get parental consent for each particular new service. And actually, because the federal government is paying for it, that maybe would be more reason to get extra consent, because there might be a financial incentive because for providers, since someone else is paying, it's somebody else's buck, so who cares? So that'd be all the more reason that parents should give consent, informed consent for each service performed. And then lastly, the minors, frankly, don't have the worldly wisdom and maturity to decide for themselves. That's why they are minors, and parents should be giving the consent until they become an adult. So those are the reasons I support this change in the law. That's it.
Thank you, Aubrey. Any questions from the committee? Seeing none.
Thank you.
Janann Archibald? And Laura, I have you down here, but you didn't say whether you were speaking or not. Okay. Welcome.
Thank you, Senator Bertzel. Thank you, members of the committee. My name is Janann Archibald. I represent One Sky Community Services. We're an area agency that represents individuals with developmental disabilities and acquired brain disorders. I'm here in support of this bill. And the reason is because the parent, I'm very concerned what's happening in the space. There's a lot going on in the Medicaid space right now. It is legal to bill outside of an IEP in New Hampshire. So the IEP process works really well. It's collaborative between the parent and the school, and we know what kind of services are being provided, especially to the disabled population. Now that some of the rules are changing, that they can bill outside of an IEP now in New Hampshire, and the Federal Register has proposed a new rule that will take away parental consent in its entirety. It's just in the rulemaking process right now, but if that does come down, I have grave concerns for the well-being of our population. The parent serves really as the coordinator of care. A disabled child may go to specialists out of state, they may go to several in-state, and the one person who kind of aggregates all that information is the parent. So if we take away the notification on what type of services are being provided to them, I worry about the quality of care. So I'm not sure what process needs to be in place, but I would really be promoting that parents stay involved throughout the.
Thank you, Janann. Any questions from the committee? Seeing none.
Okay, thank you.
That looks like that was our last speaker on House Bill 1616. Is there anyone here that would like to speak on it that wasn't given the opportunity? Do you want to speak on this one?
The family event.
So again, for the record, I'm a co-sponsor on this bill. Representative Kelly Potenza, Stratford District 19. This is my daughter, Carmela Potenza, and I'd like her to tell her story. She's extremely nervous, so give her some grace.
It's okay. We're a friendly audience most of the time.
Okay. I have suffered with anxiety and sensory processing issues my whole life. When COVID hit, I was in public school, but we decided to go back to private school that we used to go to because we thought they were going to be smart in their approach to the situation. Boy, were we wrong. I can't wear a mask, I can't breathe, and I get nauseous. Besides that, we proved that my blood pressure spikes off the charts, which happened on 3 separate occasions in a medical facility. My pediatrician wouldn't write me a mask exemption. Instead, she said I should be trained to wear a mask like I'm an animal. I had an IEP in school for certain subjects, like writing and speaking, which is why it's really hard for me to do this today.
Callie, Representative, are you talking about relative to parental consent for student participation in Medicaid?
No. We're on mask. Okay, we're on the wrong bill.
But we like what you said.
Oh, my gosh.
It was practice.
She was practicing. All right. Let's try this again. We're on House Bill 1616, which is relative to parental consent for student participation Medicaid to Schools program. Anyone would like to speak on this bill? With that, I will close the hearing. Before I close the hearing, there are 3 in support, 4 opposed that did not want to speak. So we will close the hearing on House Bill 1616.
Good morning, Madam Chair and members of the committee. My name is Kristen Noble and I represent Hillsborough District 2, the town of Bedford. As a public school parent during COVID, I remember all too well what it was like for our kids. It was a time we would like to leave in the past, but not before taking preventative measures for the future. School mask mandates had a negative impact on children's learning, their speech, their mental and physical health, their emotional well-being, and their social development. A heavy burden was placed on children to protect adults. They were treated as if they and those around them were perpetually sick, creating a climate of fear. Students were repeatedly told that they would get their family members sick if they didn't keep their masks up. They had to wear a mask for hours a day in school, on the bus, during gym class, at recess outdoors, and even while playing instruments. Students with autism, anxiety, asthma, and learning disabilities were not able to get exemptions from these mandates. However, under the governor's mask mandate, they would have been exempt. His mask mandate exempted K-12 students, teachers, and staff. School mask mandates originated with school boards. In February of 22, the governor said that schools would no longer be able to mandate masks, and those that continued their mandates would be in violation of Ed 306 rules. Some districts had already dropped their mandates by then, but many had not. Upon receiving the message from the governor and the DOE, my superintendent sent out an email immediately saying we can no longer require masks. That was not the case in all districts. In Mascoma Valley Regional School District, their superintendent was quoted in an article at the time saying, "Our board is potentially going to need to look at their mandate for masking again."
She went on to say that as administrators and teachers, we're tired of asking kids to continue pulling up their masks and explain to them why. It's just kind of a mask fatigue, if you will, on the part of the wearers and the people that have to enforce the wearing. There were mask lawsuits around the state, including one in my district. While some believe these lawsuits were frivolous, parents were desperate because their children were being harmed, and no school board would listen and adjust their policies. One can argue that they were protecting kids, but many of us had already done a risk-benefit analysis and determined that it was not necessary for our children. School boards are not qualified to make these types of decisions, nor should they make any decision on medical interventions for children without parental consent. School boards dealt with significant backlash for their mask mandates, and they should not be put in that situation again. Sadly, it significantly damaged trust between families and their local schools. If there is some public health crisis in the future, then the mandates should come from the state, where the burden of proof should lie with the experts to determine if there is any benefit of a mask mandate for children and if that outweighs the harm. I understand that the governor vetoed this in May of '22. But what is more local than a decision that parents make for their children? I am hoping that the governor will change his mind on this. I believe this bill is good for everyone, including school boards, and I urge you to pass it. Thank you.
Thank you, Representative. Senator Avard.
Thank you. And thank you for your testimony and for bringing this bill to our attention. Did they adopt the amendment 0911? I got an amendment here.
I don't have that in front of me. I don't remember what the number was.
Okay. I just wanted to ask a question about the last part of the amendment, which says, furthermore, this provision shall not prohibit policies that may require facial coverings as part of a student individualized education program pursuant to RSA 186C.
So that was added at the request of the State Advisory Committee on Children with Disabilities in Education. They just wanted some clarity around the 504s and IEPs, so I just exempted them.
Okay. And one follow-up, if I may? So when you had the hearing in the House, I don't have the hearing report in front of me or anything like that. Was there a discussion over the effectiveness of the masks versus the side effects of the mandatory mask? Was there discussion about that? What was the general conversation?
About this, there was no conversation within the committee at all. There was really only testimony.
Okay. All right. Thank you very much. Appreciate it.
So, thank you, Representative. In listening to your testimony, especially what you said at the end about experts in the public health realm making recommendations, I'm just thinking out loud a little bit. But if we were to maybe clarify your bill that specifically said that if there was a public health emergency as recommended by public health experts, would you be opposed to that?
As long as it comes from the state and not from the local districts.
Okay. Thank you.
Thank you.
Any other questions? Seeing none, thank you. Representative Kelly Potenza. We could get you done early and welcome back.
Okay, so once again, for the record, Representative Kelly Potenza, Stratford District 19. I did want to answer Senator Avard's question. It was amended it's amended by the House. So that last line 13 through 15 is in place.
Thank you.
I have suffered with anxiety and sensory processing issues my whole life. When COVID hit, I was in public school, but we decided to go back to the private school we used to go to because we thought they were going to be smart in their approach to the situation. Boy, were we wrong. I can't wear a mask, I can't breathe, and I get nauseous. Besides that, we proved that my blood pressure spikes off the charts, which happened on 3 separate occasions in a medical facility. My pediatrician wouldn't write me a mask exemption, and she said that I should be trained to wear a mask like an animal. I had an IEP in school for certain subjects, like writing and speaking, which is why it's really hard for me to do this today. My parents had to pull me out in the first quarter of school because things got out of control with the COVID protocols. Here's what I experienced. I could only wear a mask if it was under my nose. If it was over my nose, I couldn't breathe. I would get panic attacks. So I was in a constant battle with the school because it was under my nose. My science teacher said on multiple occasions to wear a mask for her mother's sake, to keep her mother safe, like I was going to kill her mother if I didn't wear a mask. She kept guilt-tripping me about it, and even got to the point of crying, which is very inappropriate. And she even sat me right next to her, which wouldn't make sense since she was very afraid. She shouldn't be teaching in that mental state. When I was in the hallway, I was walking to class, and my homeroom teacher walked up to me, touched my mask, and put it over my nose, and said there would be dire consequences if I continued not to wear my mask correctly. That was the final straw with the school, and we left. This bill should have been passed in 2022. It's outrageous that it's 2024 and we are still talking about it. I have suffered greatly from all of this, and we should make sure this never happens again. Thank you. Please get it done. Do you want to move?
My name is Francesca, and I'm here to support my sister. I've experienced a lot of the same things that she did, such as going to the store one time with my dad and not wearing a mask. We got into an argument with the workers who were threatening to call the police on us because we weren't wearing a mask. We were extremely angry and, of course, left. And another time was when I was in school. My art teacher would make all the kids wear a mask for her class, and I would refuse because I couldn't do it. And I would get kicked out until I complied and wore one. These are only the few stories that I have. This bill should have been passed a while ago, so please pass it, not just for my sake, but for other kids who have been on the struggle bus as well.
And I'm just going to end with, I can't believe in 2024 we're still here with these conversations. There was Senator Bradley, there has been so much testimony. I'd be happy to give all of that to you. That started back in 2021. We had experts that flew in from out of state, Mr. Petty, so many that talked about this. And we actually, I'm on the special committee for COVID response efficacy. And we just had a whole section about this specifically where Mr. Petty came in again and talks about the ineffectiveness of masks and all of that. So this really needs to be, medical decisions should be up to parents for minors. That's really where the rubber meets the road, not unelected bureaucrats or school boards or people that are not medical professionals. And it has to be, our choice. If you want to wear a mask, if there's some sort of special need where you feel that you need to, you can. That's fine. This is just, it has to be dictated, by parents. I can't tell you how difficult this was. And I've testified multiple times. Sometimes I feel like I have PTSD from it. It was horrible going through this, especially when I know my kid better than anyone else. We were willing to, in the guise of some fake science, say that no matter what, everybody can wear a mask. There's no more disabilities. And my kid, if you saw the blood pressure that went up the minute it was on because she can't have something that's covering her nose and mouth, it would be insane. You would never keep a child at that level of stress to induce possibly a cardiac issue. So I just really hope that we can all put this behind us. We need to really make sure, I know a lot of people say, oh, it's done. There's no virus. We just need to make sure this never happens again. So I respect all of you in this, and I hope that we can push this forward. Thank you.
Thank you, Representative. Any questions from the committee? Seeing none. Representative Quarantiello?
Good morning, Madam Chair and committee members. For the record, Representative Arlene Quarantiello from Atkinson. I am a co-sponsor of this bill because this issue is very important to me. As a member of the House Education Committee, I heard some emotional testimony last month at the hearing for HB 1093. You just heard some of it, and it's you may be hearing from some other people today who spoke then. What stood out for me was one parent who described how her child was so psychologically traumatized that he developed nervous tics due to the stress of mask wearing. According to numerous teachers and parents, some children suffered such great anxiety that they were paralyzed with fear and could not speak. Mask mandates created an academic culture of fear and divisiveness, which caused anxiety and hindered learning. Teachers explained the difficulties of working in such an emotionally negative climate and lamented that many students fell behind academically while also suffering emotionally. As I said, this is an important issue for me, and I'm a researcher at heart, so I did a lot of reading, medical journals, lots of different sources. So what I read corroborated these negative impacts. But also in answer to your question about evidence, about ineffectiveness, I found a lot, especially lately. Since this was proposed 2 years ago, I think we've learned a lot. So at the same hearing last month, I presented the objective scientific found, which raised reasonable doubt concerning the effectiveness of mask wearing. This information included a 2023 Cochrane Institute study, which concluded that, and I will quote, wearing masks in the community probably makes little or no difference to the outcome of COVID-19-like illness compared to not wearing masks. Another article very recently published just a few months ago in the Archives of Disease in Childhood concluded, quote, we fail to find any evidence of benefit from masking children. This article reviewed many different studies. It was a meta-analysis. It failed to find any evidence of benefit from masking children. Just want to repeat that. Child mask mandates fail a basic risk-benefit analysis. Recommending child masking is unsupported by current scientific data and inconsistent with accepted ethical norms. Not only did the information I find suggest that masks might possibly be ineffective, but also revealed the probability of physical harm. We heard a lot about emotional harm, but the physical harm caused by toxic chemicals contained in the masks themselves, including volatile organic compounds. I can't even pronounce some of this stuff. Phthalates, microplastics, nanoparticles. Masks are also suspected by some experts to cause a condition with the concerning name, it has the acronym MIES, mask-induced exhaustion syndrome. Do we want our children to have this in school? My point is, I'm not a medical expert. I did a lot of reading. There's reasonable doubt. There's a risk. And to quote one of the previous speakers on a different bill, where there is risk, there needs to be choice. Considering all the reasonable doubt, shouldn't wearing a mask be a choice rather than a requirement? More specifically, should school board members who are generally not medical experts ever arbitrarily mandate the wearing of face masks? This bill will not stop anyone who wants to wear a mask from doing so. Those who believe that face masks are effective can certainly keep on wearing them. And parents who want their kids to wear masks could still send them to school wearing them if that situation should arise again. Let's hope it doesn't. But we need to be prepared. Logically, the people, this is what gets to me, the people who wear the masks and they believe that they're effective, shouldn't they also believe that those masks will protect them against those not wearing the masks? That's why the element of choice seems like a reasonable thing to ask for. We're not putting anyone else in harm that wears a mask. Ultimately, HB 1093 would relieve school board members from having to determine controversial face mask policies, avoid these lawsuits that have already arisen. It would also protect the rights of parents to decide whether or not their children wear masks. So, for all of these reasons, I urge you to pass this bill. I know you probably have many things to read, but I do happen to have a copy of my testimony, which was longer for the House committee. The reason being, it has a bibliography of many sources about the ineffectiveness of masks, so I'll hand those out. Thank you. I'd be happy to answer any questions.
Any questions from the committee?
Thank you, Madam Chair. Did the school boards or teachers union come out and testify on this particular bill?
I'm sorry, may you
Did the
repeat?
school boards or teachers unions come out and testify on this bill?
There was a lobbyist from the School Board Administrators Association. I mean, this was last month, so I can't remember exactly who spoke against it. And I don't know if I'm,
You answered.
I'm the clerk, but I wasn't clerking then because I was testifying. So I took a break, and so my memory's not as good.
Thank you for your testimony.
Okay.
Any other questions? Seeing none. Thank you.
Thank you.
Representative Polozov.
Thank you, Madam Chair. Representative Polozov, Representative Mary McTen, Hooksett Dunbarton. So, previous mask mandate in schools was pushed with premise of saving kids from the danger of COVID, but it was not based on science. Were the kids ever at risk of COVID? Even early data from China, Wuhan, showed that kids are not the vulnerable population from COVID. And the same we saw in other states who had experienced COVID spike earlier. And how many kids in New Hampshire died from COVID? So I give you official data from DHHS. So for all the COVID years, so on one side ages 0 to 9, another side ages 10 to 19. So it's one death officially recorded allegedly died from COVID from the first category and 0 for the second. So total one death for all those years. And even that, I would say, it didn't happen in New Hampshire, and it was not otherwise healthy kid. So I also have some causes of death compilation. It's based on CDC, and it's not just Republican talking point, because this was composed by extreme left organization NAMI, who agrees that number 4 reason for death for ages 1 to 4 in New Hampshire was combination of COVID, diabetes, heart disease, flu, and other diseases. Why this combination? Why the specific combination? In previous chart, you saw there was only one death. So that one death was a kid who was dying from this combination of diabetes, heart disease, flu, other diseases. But they allegedly also tested positive for COVID, so they put COVID as a main reason of death. So my point we see that mask mandates were based on fear, and unfortunately the state failed in informing public, but even legislators correctly. Last year, DHHS and state epidemiologist Dr. Chen testified in the General Court that COVID remains the major cause of illness and death among kids. So it's at very best misleading. So, and nobody was punished for those harmful mandates. Officials and groups who testified it are still in power. They still want more mandates and future mask mandates. So this bill is a minimum that can be done. And as another member of House Special Committee on COVID response efficacy, we heard from specialists that many masks are not effective, especially when it's aerosolized particles, how it's spreading for COVID. And it should be special respirators, not masks, to be at least somewhat effective. It should be fitted. You cannot just put an adult mask on a small kid without fitting it in. If there are gaps, there's no efficiency. And so it was not science, and it was harmful. So please don't repeat it.
Thank you, Representative. Any questions from the committee? Seeing none. Thank you. Representative Horrigan.
Once again, I continue to be Representative Timothy Horrigan. I continue to be from Stratford County District 10, the town of Durham, and I feel bad about this, but once again, I continue to be opposed to the bill that my colleagues in the House sent over here. Well, for one thing, to talk about the effects of the mask wearing on the children, I know I personally hated wearing those things. It made me anxious, but I felt I needed to do it. And so also so the children who went through that period, obviously that was not a good thing for them, but wearing the mask was not the only thing that was unusual during that period. So some of these effects were probably, it's hard to tease out which of the bad effects were caused by masks and which were caused by other unusual things that were going on during those 2 or 3 years when everything in schools and every other institution was abnormal. And if you go back to where we were in March 2020, all we really knew, and this includes school boards as well as everyone else, was that there was an extremely dangerous respiratory virus going around. And so, in retrospect, some things we did work pretty well. And actually, I think the masks worked okay. Some things we didn't work so well, but we were facing a very serious situation, and there is no constitutional, natural, or inherent right to spread a deadly respiratory virus. And as it turned out, the death rate among children, I guess, was lower than amongst older people. It was mostly older people like myself. I remember I felt sort of insulted when somebody dismissed the death of our House Speaker, Dick Hinson, described him as a 70-something comorbid, because if you remember, and I think part of it was supposedly he was a little bit overweight like me. So I was a little bit younger, but I wasn't that much in his age bracket. So I sort of took offense to somebody describing him as, 70-something comorbid, because I was a 60-something comorbid at the time. But anyway, so actually, I think the mask is certainly not perfect. I mean, it's easy to mock the arguments against the mask, because apparently, if you take all the arguments against them, they cause severe anxiety. They block off all the oxygen, so you have hypoxia, you're breathing in nanoparticles. E. coli, apparently they block everything except the COVID virus, and that was not necessarily true. And the masks were there both to protect the person who's wearing them and the other people around them. And even though children had a lower death rate, they still could spread it to the adults in their lives. They were still they were still inhaling the virus like everyone else. They just weren't getting killed by it as much and inhaling it to other people. So I think, anyway, to get back to this, schools should have the right to decide how to deal with a public health emergency like that. So I think, and that may include in the future face masks. And they actually weren't quite as ineffective as people say, because the rates of the common cold went way down. The flu season, which is often a problem, especially during some of the worst parts of it, were the spring of 2020 and then also the winter and spring of 2021. There's often a seasonal flu season. There really wasn't a serious one in either of those years, which implies that probably the masks may have actually been helpful for that. I'll also say the pandemic was first detected in the Far East, and in countries like China and Japan, mask wearing was a fairly accepted practice even before there was a pandemic. So if, the people in, so at least in those cultures, that was, people already knew how to deal with it. So perhaps we probably learned how to deal with it too. And so one thing I finally say, we hear a lot of comments about how bad the masks were, how bad the vaccines were, but it's dwarfed by what the virus itself did. So I'll just read a couple of sets of numbers here. As of March 2023, when we stopped officially counting, New Hampshire had 378,428 detected cases of COVID, and they had 3,003 deaths, which is, it's a significant number. In the USA as a whole, there's 103,802, 702. I mean, these figures are probably more precise than this. Anyway, that was the official number of COVID cases. And there are 1,123,836 deaths, which makes this one, even though we don't talk about that part of what happened over the last 4 years, that's one of the worst catastrophes in U.S. history. I think the only thing that had a higher death toll was the Civil War. So this is, this is a very serious thing, and it could have been even worse than that. I think everyone feared it would be even worse than that. And I think the mask mandates, they certainly weren't fun. Not everyone could wear them, but I think it was probably not an unreasonable thing at the time. And it may be something, I don't think we should forbid school districts from doing this in the future if we have a similar respiratory outbreak. And also, I will say the way this is worded, it doesn't cover all schools. It's just intended to cover school districts, so regular public schools or charter schools or public academies. So it leaves out private schools. But in the years since then, private schools have now, we're moving towards subsidizing private schools through the school voucher program. So it may be, it might be, it's inconsistent not to put any language regulating what they can do, what they should do, or what they should not do in a future pandemic, since I don't support this policy, but it seems to have support and it's going to be around for a while for subsidizing private schools with taxpayer money as well. So I would just say this bill is unnecessary, and so I would urge you to either pass it or at least give you a general letdown by doing interim study. So I'd be happy to take any questions if you.
Any questions from the committee?
Not like you. Great. All right. Thanks. Thanks for your time. Thanks.
We have 7 more speakers and we have 1 more bill left. So I'm going to ask to be a little bit quick. So we have Teresa Bass. Okay. Melissa Blasek.
Hi, I'm Melissa Blasek. I am here representing Rebuild NH. I'm not going to talk about, why masks don't work. People are going to cover that. They're going to talk about their own issues with wearing masks and why there needs to be choice. But I just wanted to hand out this. This is the policy guidance from the New Hampshire School Board Association. To kind of answer Senator Avart's question from earlier, in the previous hearing for this bill, the New Hampshire School Board Association did come and testify that they were just following state guidance. They don't have their own guidance. I have this policy that school board members have sent me who are supporting this bill, and it does have masking still as their default essential guidance for any disease outbreak. So I'm going to hand that into the committee. So this is still, I think some people are like, well, it's not a big deal anymore. We're not doing masks anymore. We've allowed this pseudoscience to sort of become the default position for all disease outbreaks. And I think that that's the real issue, that we need to do something about this long term. That's it. Thank you.
Any questions from the committee? Seeing none, thank you. Eric Power.
Morning, honorable members of the committee. My name is Eric Power. I'm from Brookline, lived there 30 years. I'm also the president of the School District Governance Association of New Hampshire. It's a group that looks at doing governance and fiscal prudence and educational excellence in the state. And we're very much in favor of this bill. The mask mandates really did a lot of damage, as you probably heard, to our students' learning, especially the younger ones. And it really is a parental rights issue for students that are not adults. And if they're adult students, they should make their own decisions on whether they should be wearing a mask or not. The school boards do not have the medical expertise to be able to make decisions on medical devices, and they should not be making policies that do such. So it really did a lot of damage. I think we've learned from it, and I think it's important that this bill gets passed so that school boards don't have to even decide whether to do. The state will make the guidance if it's really necessary. They're not going to have to deal with the people that want the masks, the people that don't want the masks, because I think the masking isn't really going to be in a particular town or group of towns. It's going to be a statewide situation if we really do need them, or any other medical device. So I did serve on the school board myself for 3 years, and I would feel comfortable with not having that authority and that responsibility to do that. I think it's better for New Hampshire students and letting the parents decide. If parents want to send their students to school with masks, they can do that. An adult student can decide to wear a mask if they'd want to, but to require it of everybody doesn't make any sense, and I think this bill is very important. So thank you very much.
One question.
Senator Abar.
So thank you for your testimony and appreciate your service on the school board. Senator Bradley did mention that if the state took basically a bigger role in this rather and take that away, you'd be okay with that? Basically, if it was a state mandate?
I think if it was a state mandate, I'm not really a big fan of masks myself, but I would honor that more because I think that would come from more of an authority if that was necessary. And we're not going to have Hollis Brookline, where I'm from, having masks and Nashua not having masks. It would be really a response we would have to do statewide to make sense. And I think that's why this policy puts this decision at the right level, at the state level, and I think that's important.
Thank you. I appreciate your testimony.
No other questions? Thank you.
Thank you very much.
Julie Smith.
How about now? Julie Smith from Nashua. I support this bill. First of all, I agree with Mr. Power that it is a parental rights issue, and that leads into something that happened 1 year ago, 1 year ago tomorrow, before SB 272, a parental bill of rights, was introduced in House Education. Shortly before that, I had my last in-person conversation with the late, great Mr. Clegg in the kitchen, and he pointed out that committees hearing bills of great interest tend to only remember the words of just a few people speaking. I know I'm not that special and don't expect to be one of them, but I want the committee to consider the steadfast opinion of the expert Dr. Petty, who was mentioned earlier, and who made 3 trips to Concord that I know of. Spoke to House Education on 2/25/22 during a blizzard,
and to this committee on 3/30/22 with 3 of its current members present, and recently to the Special COVID Response Committee. Follow the science, we regularly hear ad nauseum. Well, he is the science. As for minds that change as part of the Enlightenment process, I recently had an unexpected encounter, also in the kitchen, with one of your colleagues, perhaps the brightest legal mind in the Senate. While discussing the voting record of his predecessor, he said, "Gee, I really wish I kept a journal through the whole COVID timeline," he said to me and Nurse Therese, as he cited a few examples of decisions he made, both personal and professional, that he thought, based on knowledge available at the time, was in the best interest. I doubt there will ever be a sincere apology from my reps, my aldermen, the mayor, or the school board, which was mentioned earlier is the origin of this current issue, and the latter of which has muzzled thousands of Nashua students and arguably also parents at my expense as a taxpayer. Because I don't have kids, I consider myself one of the fortunate locals, and I'm here today to say never again, whether or not the affected students and their parents are still paying attention. To anyone crying local control, I say that 3 of the famous 4 boxes of freedom have been an abject failure in Nashua. I suggest talking to Paula Johnson, formerly of the school committee, for personal examples of all 3 and why this bill is desperately needed. The swing voters have an opportunity to use their power in a good way in this committee and in the Senate chamber. Let's move things along, ought to pass, with the same expedience that was used 2 years ago in Reps Hall for that restroom pass bill, HB 1130, which 3 members ought to remember. To use some marathon speak, I will close by urging the committee to concentrate on the strategy further down the road, Heartbreak Hill, also known here as the corner office. Let's not waste any time stalling, just do it. And thank you for the time.
Any questions from the committee? Seeing none, thank you. Sean Rogers.
So in recent years, public educators have increasingly been accused of putting their own needs above the needs of their students. And I do think that the mask mandates were an egregiously bad example of that. It was known very early on during the pandemic that healthy school-age children were never considered to be at high risk for the complications of COVID-19, and yet children still had the masks forced upon them, even though masks and mask mandates have never to this day been proven to be an effective strategy to reduce transmission of respiratory viruses. Not only that, but it was anticipated early on that the mask mandates would adversely affect children in their social, emotional, and linguistic development, which has borne out to be true. So in the end, since children were involuntarily subjected to experimental mask mandates that had few objective benefits but did have definite harms, I believe that we should leave medical decisions to the patients, to the parents, and to the healthcare providers. School boards, even when advised by experts, are, I think, hopelessly biased in their decision-making and have not the moral, legal, or pragmatic basis to make such decisions for an entire population. And on a personal note, as a parent, the mask mandates have given me a compelling reason to seek out private education in the hopes that we don't have to ever deal with that again. And I do hope that we see school choice here in New Hampshire so that everyone can have that option if something like this were to happen again. So, thank you.
Thank you, Josh. Any questions from the committee? Seeing none. We have 2 more speakers. Aubrey. And keep in mind, we have 1 more bill after this, so. Welcome.
Yeah. Madam Chair, committee members, Aubrey Friedman, Bridgewater. I speak in support of this bill. There are germs in this room right now. Anytime you go out in the public, there are germs, and some people are more worried about it and some people are less, and to health risks, and to try to make everybody respond the same way is a one-size-fits-all. It definitely didn't work. I live in Newfound, SAU 4 school district. We had such fighting going on for about a year about the mask mandate. And the pro-mask people would sit in one side of the auditorium, and the anti-mask people, like me, would sit on the other side, and they would cite studies showing that the masks work, and we would cite studies showing that the masks were ineffective. It was nothing but a big hassle, fighting. We got totally distracted from what schools are supposed to be all about, are promoting academic literacy. Instead, we were fighting about this mask thing, and it was just was a waste of time. And so I hope we don't have to go through this again. And I might want to add, oh yeah, I did want to say something. So I would speak at each school board meeting, and so while we were fighting about this, they always kept track of the cases that were going on in the school. They had a real record-keeping system on it. And as the mandate went on and on till like was mentioned, till the governor dropped it, the cases rose every school board meeting. I said last week we were at this number, we're at higher, and they kept on going up and up despite the mask mandate. So it didn't change the school board. They said, we defer to the health authorities, the CDC, DHHS, and we just defer. It was a big hassle, a distraction. And I might just add, this one might be a good reason to expand school choice, because for those people who feel you want to be all around people who are wearing masks, you could maybe go to schools that would have a mandate. You choose that. Or the people like me who don't want the mask, or we want it optional, then you could go to schools that had it optional. So I just think maybe that's a reason to have more school choice. And I might add just one more thing, is when they dropped, despite all the fighting and the animosity and everything, when the mandate got dropped, when the kids came back for winter break in 2022, hardly anybody wore the mask and nobody cared. There was no more fighting. We had peace in SAU 4. So hopefully, and this bill I think is necessary because they're talking about already disease X, bird flu. There's going to be hysteria again about, hopefully not as much. So this is for the future. I think it's an important bill, and that's why I support it.
Thank you, Aubrey. Any questions from the committee? Seeing none?
Thank you.
Last speaker, Gary York. Welcome.
Thank you, Madam Chair and Senators. My name is Gary York. I'm from Hopkinton, New Hampshire. I feel like I've been testifying for cases like this that relate to mandates for a long time now. So, but after 4 years, we have the advantage of looking through the retrospectoscope where vision is 20/20. I think my main argument for having no masks is that they just simply don't work. Masks don't work. So when we have the debate about should we have masks mandates or should the schools have masks, why don't we just focus on the issue that they don't work? I don't know how many people have come to that realization, but you know, I haven't followed corporate media outlets for a long, long time, but I've got plenty of information to tell you that they don't work. And I would agree with Representative Coratello, who mentioned the very large study done a year ago that was a meta-analysis of 78 different randomized controlled studies. And that included nearly 300,000 participants. And they looked at these participants' mask wearing versus no mask wearing. And one part of this study was for influenza-like virus / COVID-like virus same group. And that was the majority of the population. And another subset of smaller portion looked at actual participants that had been proven or tested positive for either a flu-like illness or influenza illness or COVID-19 illness. And for both of these populations of 300,000 people, and this goes back to 2003 for respiratory viruses, respiratory illnesses caused by viruses. And it's worth repeating the conclusion. Wearing masks in the community probably makes a little or no difference to outcome of influenza-like illness / COVID-like illness compared to not wearing masks. There we have it. I don't know if that made the mainstream media or not, but we should all realize that this is the best information that we have that masks don't work. In addition to what's been said before, Stephen Petty came by last year or 2 years ago to talk about that. So aside from the trauma caused by masks, the learning disabilities caused by masks, aside from all that, and then the question about, well, what would you support a state mandate to have the mask mandate if an emergency came up again? But if they don't work, they don't work. They're not going to work better because it's a year later. So I'd like to just ask you to, keep my motto on my license plate, live free or die, because this to me is a medical freedom issue. Putting something on my body to cover up my face, what are you going to tie up my hands next time? Or let's not have New Hampshire be known as a mandate state. I sent to you through email, didn't want to waste paper, and I had some valuable links on that email I sent you. I hope it didn't go to spam. Please retrieve it if you did. Gary York, glyork@pm.me, which references this extensive study, landmark study of these participants, 300,000 participants. And it has the link for that, and it has the study in its entirety, and it has a synopsis, including for a layperson to review that. It's not all scientific because there's a synopsis in the layperson language. In addition, I give you several other links to different news sources that I adhere to, and many of us adhere to, that you may not be familiar with, but it's an introduction to see where the news is coming from when it's not mainstream / corporate media. So please review that and maybe understand, like I do, that masks do not work. And I respect people who want to wear a mask. It's all about medical freedom.
Thank you. Any questions from the committee? Seeing none. Thank you.
Thank you.
That is the last of our speakers. I am just going to say that there are 6 people who signed up supporting it and 7 people opposing it. And with that, I will close the hearing on House Bill 1093. And Cam is ready. We'll get on to our last bill. going to open the hearing on House Bill 1660 and invite the prime sponsor, Representative Kofalt.
Kofalt. Thank you, Madam Chairwoman. Thank you, members of the committee, for hearing my testimony. For the record, my name is Jim Kofalt. I represent Hillsborough County District 32, which includes the towns of Wilton, Temple, and New Ipswich. So the question of gender reassignment procedures on minors in particular has garnered a great deal of attention recently, and several countries have gone so far as to curtail such procedures. A number of states have curtailed such procedures. As you may know, House Bill 619 was sent over to this body in January, and that would actually impose an outright ban on certain gender reassignment surgeries for people under the age of 18. This bill does not impose any such ban. This bill simply states that taxpayers should not be on the hook to pay for gender reassignment surgery for minors. It does not prohibit coverage for adults. It does not prohibit coverage of puberty blockers for minors. It is really just limited to barring Medicaid from covering gender reassignment surgeries for minors. This bill specifically addresses gender reassignment surgery, and it does include so-called top surgery. It includes top surgery not in the event of a breast reduction required for medical purposes, but rather where gender reassignment is the objective. Several questions came up during the first hearing for this bill and regarding specifically what it would include and not include, and the committee felt that those questions had been adequately answered. So the committee on the House side chose not to amend this bill. Having said that, if this committee determines that the bill does require further clarification, I have taken the liberty to prepare a draft amendment for your consideration, which draws much of its language from House Bill 619, going into considerable detail about certain anomalies that would be considered medically necessary and permitted versus what we would generally know as gender reassignment surgery, which would not be covered under the state's Medicaid program. So I will distribute that draft amendment momentarily for your consideration. Finally, I want to add that a colleague of mine on the Health and Human Services Committee did raise a concern that this bill would, in effect, create a two-tiered healthcare system in which those who can afford private healthcare have access to services that those who do not have access to private healthcare would not be able to avail themselves of. So I did a little bit of research, and I found that there are quite a lot of differences across various private healthcare health insurance plans. Some of them cover these procedures, some of them do not cover these procedures. So I just offer that as a means of putting to rest the concern that this would be a kind of two-tiered healthcare system for the people of New Hampshire. That concludes my testimony. I will distribute the amendment and take any questions.
Senator.
You need me to write him up? Let's wait till he did.
Representative, thank you for taking my question. It's somewhat along the lines of what you just spoke about in terms of private insurance and an exclusion, but a private versus, a public form of insurance and exclusion. I wanted to know if you had any other examples within the state Medicaid plan of procedures, treatments that were excluded. Where you're seeking to exclude one, is there a line you can draw to another one that's precedent setting?
I'm not aware of other specific procedures that are explicitly excluded in statute. I do know that this was added in rules. Coverage of gender reassignment procedures were added in rules in, I believe, 2017 or 2018. So no, I'm not aware of I'm not aware that there are or there are not such exclusions built into statute. I do know that also that, it is a sort of foundational premise of the Medicaid program that it does not cover procedures that are medically unnecessary. There will be people, I'm sure, who argue that it is medically necessary. I take exception to that.
Thank you.
Thank you, Madam Chair. So because we're talking about the Medicaid system, we're talking about healthcare services, and, we're talking about healthcare services that are, prescribed, sort of prescribed or recommended. We're dealing with parental consent here. And so, there are doctors saying that this is medically necessary. But what I'm concerned with is sort of the legality of this. As Senator Prentice had identified, we don't do this in New Hampshire. We don't sort of target one particular healthcare services. We never have in the Medicaid program. And so, are you concerned at all that this could potentially violate federal discrimination law? And I think if you're not, I would want to bring your attention to the fact that a federal judge just recently blocked a ban similar to this bill in Florida from taking effect, citing it as unconstitutional. Are you concerned with that at all?
So I think that is up to the federal courts to do if they so choose. As far as this carving out a specific, and let me by extension say, I think that it is up to the people of New Hampshire and their elected representatives to establish what we want to do here in New Hampshire. If federal courts find that to be objectionable or unconstitutional, so be it. I think that's for them to decide, but this is the position I believe that we as elected officials should take. As for the question of excluding specific procedures, I would comment that these specific procedures were added in statute. Were added in rule, rather. So barring the ability for us to remove them from rule as legislators, statute is our vehicle for reversing that specific inclusion of these procedures or for barring some subset of those specific procedures. And so that's why I brought forward this bill.
So I agree, there's certain things that in the legislative branch we are able to do, but we are not able to violate the Constitution. And so even if the legislature thinks that this is the policy they want, we're not allowed to violate the Constitution. That's pretty clear. And so in addition to the Florida case, are you aware that in Arkansas as well, a federal judge blocked the state's ban similar to that's being attempted here? Not just Florida, Arkansas too. Are you concerned with the constitutionality at all?
Well, and so I agree that as legislators, we should be looking at the Constitution in everything we do. Having said that, the opinion of one or another judge, and I think we could all find examples of circuit court decisions that we think are violate our sense of what the Constitution says. Ultimately, the Supreme Court decides on those kinds of cases. I suspect that this ultimately will go to that level, as there are a number of states that are saying they don't want to put taxpayers on the hook to pay for these procedures. And in fact, in the case of people under 18, many states are saying it's inappropriate and dangerous to be allowing these procedures in the first place.
Sorry, last question. So we're talking about more than just the Constitution here. We're talking about federal law. And as you know, federal law, we are guided by federal law. We can't violate federal law. It takes precedent over state law. Federal law is very clear that it prohibits discrimination in healthcare on the basis of gender identity. Are you concerned that you're violating federal law with the passage of this bill?
So respectfully, Senator, I think that you are arguing that the law is settled, and I'm arguing that the law is not settled, that we should have a position. This is my position, and that's why I brought forward this bill.
Thank you, and thank you for your testimony, Representative. I'll just confirm, the question about procedures explicitly excluded in the state, wasn't conversion therapy banned?
Thank you for the question. Yes, it is my understanding that so-called conversion therapy is explicitly banned in statute.
So that would, oh, thank you. That's all I wanted to ask.
Thank you. I want to clarify, are you aware that conversion therapy wasn't covered by Medicaid? So that's not a Medicaid service. We did ban it because it was not an appropriate service, but it was never covered by Medicaid. Are you aware of that?
I was not aware of that. Thank you.
Thank you, Madam Chair. So we have two bills that deal with the same subject matter. Your bill is specific to Medicaid. The other bill, I believe it's 619, is
Senator,
broader.
could you speak up a little?
Me?
Yeah.
The Senate is in possession of two House bills, your bill, and I believe it's House Bill 619.
Correct.
Both of which do the same thing. Yours is confined to Medicaid only. The other bill is for any minor under the age of 18. If we were to pass that bill, is this bill necessary?
It's an interesting question, and it's one that I've tried to do a little bit of research on. I have not completed my research, but here is my concern. House Bill 619 prohibits gender reassignment surgery on minors in the state of New Hampshire. It is not clear to me whether or not the Medicaid program, this New Hampshire Medicaid program, would cover such surgeries performed in other states. If that is the case, then this bill would still be required.
Okay. All right. We can talk offline.
Thank you. May I actually add one additional thing? House Bill 619 focuses on so-called bottom surgery, surgery on the genitalia. This bill also extends it to so-called top surgery. Typically, this is where a young woman decides that she wants to identify as a male and has her breast removed. So that is included in my bill. It is not, I believe, included in House Bill 619.
Thank you.
Thank you.
Courtney Reed.
Thank you, Senators, for taking the time to hear my testimony. For the record, my name is Courtney Reed. I serve as policy advocate at the ACLU of New Hampshire, and I'll be speaking in opposition to this bill on behalf of the organization, in that because HB 1660 excludes explicitly treatment for gender or sex reassignment, or in other words, although rarely indicated, medically necessary treatment for gender dysphoria, this bill targets and discriminates against someone based on their transgender status or against gender non-conforming people in the Granite State. The sponsor of the bill spoke to how there are exceptions to mastectomies when medically necessary for minors in other instances, such as breast reduction for back pain or perhaps for breast cancer. And that specific exclusion implicates that when a transgender individual is seeking this type of care, and it might be medically necessary for them, that care is less valid when indicated medically to be medically necessary for someone who might be cisgender or identifies as female and was born female at birth. I just wanted to speak a little bit to the legality behind this that was touched upon a little bit already. There are multiple court decisions that have ruled that a categorical exclusion of gender-affirming care or this type of care violates the Affordable Care Act, that it violates the Constitution and is discriminatory. That isn't only in the cases that Senator Whitley cited in Arkansas and Florida, but has also come out of the Fourth Circuit, coming out of bars from Medicaid and state insurance plans in North Carolina and in West Virginia. But not only that, there have been decisions coming from the federal level against these types of exclusions, coming from the Department of Health and Human Services that implemented a rule on implementing the Affordable Care Act, citing that, once again, categorical exclusions are discriminatory on the basis of sex and have also been interpreted to violate Title VII of the Civil Rights Act, and that states are compelled by the Affordable Care Act to have benefit designs that are inclusionary of medically necessary services. And so after that decision was made and after New Hampshire expanded its gender identity protection laws, the New Hampshire DOI actually issued another bulletin in 2020, which I've handed out along with my testimony. You'll see collated in the pages that also explicitly says that insurers are prohibited from denying or excluding medically necessary services based on an individual's gender identity. And I can't really speak to what the prescription of these types of procedures look like. I just wanted to give a little bit of a legal background of what's happening when other states block this type of care. But I'm happy to take questions otherwise. Thank you.
Senator Abar.
Thank you, and thank you for your testimony. And the previous speaker did say that he didn't feel that the law has been settled. So has the Supreme Court settled any arguments on this? Has it gone to the Supreme Court as to whether this is discrimination or not?
There is one case, thank you for your question. There's one case at the Supreme Court, and there has not been any decision that's come from that body on the merits of that case.
Follow up? So would that mean that it's still not settled yet?
By the Supreme Court, yes. But the Fourth Circuit has had multiple cases that have ruled that this type of care, or the exclusion of this type of care from state plans, violates federal law and the U.S. Constitution, and that is the highest ruling thus far. The First Circuit, which governs New Hampshire, has not taken up this case yet. Thank you.
Good morning, Chair Birdsell and honorary members of the committee, and thank you for hearing our testimonies today. My name is Michelle Silly-Foisey. I am from Temple, and I am here in opposition of HB 1660. I am a physical therapist and a mom of 6. In both of these jobs, I have over 20 years of experience. While working as a PT is very different than being a mother, I feel both have contributed to my understanding of the importance of medical decisions being very personal ones that deserve support. And during both my time as a medical professional and as a mom, I have always done my best to provide that support. When working with my patients, I support them by educating and informing them. And while being a mom, I support my children by listening to them, trusting in them, and doing all I can to research and find doctors and medical professionals that can provide the best care for them. Over the last year, I have supported my 17-year-old through the most difficult times of their life up to this point. In March of 2023, for the first time in my presence, they expressed they were experiencing near constant suicidal thoughts while at a physician visit. Immediately, we sought counseling for them. After beginning therapy, they were slowly able to talk more openly to us about things, and their gender dysphoria became apparent. In September, they came to me and asked if they were too old to start hormone therapy. Witnessing the self-isolation and severe depression they have endured has been horrific and painful as their mother. A heartache I hope few parents have to cope with. We are incredibly fortunate to continue to have our adolescent here with us today after their attempted suicide. In October of 2023, I sat in a doctor's office while at their side as they revealed details of that attempt. Their attempt was before they came to me about hormone replacement therapy, before they were able to express how lost they were feeling in their own body. Now there is finally light creeping through the darkness they have been living in. As their mom, I am able to feel hope again for their future. I am grateful every day that their beautiful face is still here for me to touch. I know for certain that they would not be if it wasn't for the compassionate, essential, gender-affirming care their father and I consented to that they are now receiving. If my adolescent is unable to live in a body that they were biologically given at 16 years old, I cannot comprehend how that suddenly becomes an insured right at 18. Most importantly, I cannot fathom how is it expected that their mental health would support them to live through such struggle to reach 18. Our trans community in New Hampshire will not survive the loss of medical care that this law would bring. Many transgender people die by suicide due to their gender dysphoria they experience and the extreme mental anguish that our society's lack of acceptance imposes every day. It does not have to be this way. Gender-affirming care is not only life-saving, but it is life-giving. Hearing my teens say that they are finally able to look at themselves in the mirror and smile again is just one example of the positive impacts it has brought to their life. HB 1660 seeks to remove the insured financial support loving, supportive parents and families could provide to the vulnerable trans youth within the Granite State. And furthermore, I encourage you to ask yourselves why it would be appropriate to single out the low-income community in our state with the additional challenges they already face. It would exacerbate the isolation a transgender adolescent will be expected to persevere through while waiting to reach the age of 18 to receive the care they may desperately need to survive. This may be the breaking point they can no longer battle against. Please vote ITL for HB 1660.
Thank you, Michelle. Any questions from the committee?
Thank you, Chair Brazil. Thank you, Michelle, for coming before us again. I think I've seen you in Senate Education and here. I appreciate your testimony. So my question is for you that, has this been a multi-year process working with medical professionals and your children, as well as, working with medical professionals to even come to a point where you sought, some type of medical treatment, entering into hormone therapy?
For my child, thank you for your question.
Yes.
It has been a year-long process to get to where we are currently. And yes, we have worked very closely with the doctors and the counselors. It's not been I want hormone therapy to start. It's been lots of procedures before that actually reached that point.
Okay, thank you.
You're welcome. Thank you.
Hello, my name is Linz Jakehouse. I use they, them pronouns, and I am a non-binary person. To me, that means I feel like simply a person, not a man or a woman. I will be 34 next month, and I received top surgery to relieve my gender dysphoria when I was 25. Surgeries such as these are only ever done for teens after much conversation between parents, doctors, and the teens themselves. Beginning at puberty, I felt extremely uncomfortable with my chest. This was in the early 2000s when I learned about what it was to be transgender through the Learning Channel documentaries that were extremely surgery focused. As a young teen, I watched these mini documentaries where trans men got top surgery and felt extremely jealous, wishing I could do the same thing, but thinking that it was impossible since I didn't feel like a boy. I thought there was nothing I could do until my early 20s, in my early 20s, I met a non-binary person who had gotten top surgery and realized it was possible. I began therapy to discuss the feelings I was having about my gender, started exploring surgeons, and needed a letter from a therapist I had seen for at least a year before getting approved by a surgeon. I name this to say that there are already so many hoops that trans and non-binary people need to jump through before we can get approved for the medical care we need. I was also racing up against a clock before I turned 26 and would be kicked off my mom's health insurance. And I spent the year before I turned 26 doing as many odd jobs and gigs I could possibly do on top of my day job to save the $4,000 that I would have to pay out of pocket. My mom's insurance covered another $4,000. I cried with joy, finally feeling at home in my body after getting surgery, and I still say it's the best money I ever spent. We should all be so lucky to feel at home in our bodies. In 2017, I watched as a joint legislative committee on administrative rules voted to remove the exclusion on Medicaid covering gender-affirming care, saying that it was required to be in alignment with the non-discrimination protections of the Affordable Care Act. Again, so many trans people I know and love wept with joy knowing that they could get the care they needed without waiting and saving an astronomical amount. This non-discrimination principle was something we accepted even before New Hampshire passed the 2018 non-discrimination law with support from Senators Bradley, Innes, Gray, and Reagan. I urge you to not reverse this course just because some people have launched a fear-mongering campaign. We cannot ban Medicaid from covering a procedure simply because certain people don't like it, as the House recently affirmed when they stopped a proposed ban on Medicaid covering circumcision. While I was not a teen when I got top surgery, I knew I needed it from a young age. Trans and non-binary teens know who they are and what they need. Listen to the people who would be affected by this bill. They should all be as free as I was to make my own medical decision between me and my doctor. Vote ITL on the bill, and I'm happy to take any questions.
Thank you, Liz. Any questions from the committee? Seeing none. Thank you. Bethany Morabito? Yeah.
Thank you for hearing my testimony today. For the record, my name is Bethany Morabito. I'm a resident of Kentucky, New Hampshire, a private resident. I am speaking from the perspective of, I used to work for an organization called Health Market Connect, which is based out of here in Concord, which helps connect people with health insurance resources and how to access them, specifically through Medicaid, CHIP for children, the Marketplace, also known as the Affordable Care Act, and Medicare. So my position within that organization was Director of LGBTQ Health. So a huge portion of what I did is I received referrals from other organizations or individuals who were starting the process of their gendered care journey as adults or advocating on behalf of their children to start those procedures. So I feel like I have a pretty good perspective when it comes to understanding the public access of insurance to those programs and the specific population of people who are seeking that out. So I wanted to first start about, when families would approach me specifically who were eligible for Medicaid, I would often see maybe an average of kids around 15 or 16 years old beginning the conversation, wanting to access therapy, wanting to get a diagnosis of gender dysphoria, and having to walk them through kind of like step by step what the therapeutic and medical responses would be on this journey and how Medicaid and CHIP would be covering the services that they were seeking and or the Marketplace and what those prices looked like if depending on eligibility. So I predominantly saw teenagers really starting the journey of gender affirming care, which is more than just surgeries. It can involve hormone therapy and many other types of procedures around 16 or 17. So we're already talking older teenagers who are coming into their own and dedicating themselves to figuring out where they are and who they're becoming as adults. Speaking in regards to the Affordable Care Act, as I mentioned, I am certified on the CMS platform, that's Center for Medicaid and Medicare Services. You have to be in order to be a healthcare navigator to be able to assist people. The ACA is very explicit about its requirements for health insurance seekers to be able to access care without discrimination, and this bill would violate the ACA. The LGBTQ community is part of many groups identified as needing assistance with access to care. CMS, blatantly detailed in our grant application the specific underserved groups that needed to be assisted with access to care, with the LGBTQ community being part of it, but also substance abuse communities, rural communities in New Hampshire, immigrant communities, etc. All right. So CMS, as I mentioned, is the federal agency that oversees and provides health insurance access through programs like Medicaid, Marketplace, and Medicare. So people who are looking at care at any age through the system should be able to access it with the support of their medical team and not be subject to discrimination. Specifically, my concerns with the Medicaid piece of it is that due to the federal poverty line, people either go into one program or another. They're either qualified for Medicaid based on their income. I know that the income levels for CHIP are higher, or they go into the Marketplace. If they can go into the Marketplace, I can speak to which plans available on the Marketplace do coverage under affirming care. I would say all of them do. Some of them do more in a hidden way, but some of them are very blatant about covering care. But again, if this bill was to pass, it would be unfairly targeting poor children who are required to be on Medicaid if they want to be covered with their health insurance, and it doesn't give them access to life-saving procedures through gender-affirming care. They don't have another option unless they're willing to pay out of pocket, and we already know that if they're on Medicaid, that's a huge roadblock and barrier. So that's specifically why I wanted to raise my voice, at least about accessibility and access to care. I wrote a bunch else, but I feel like I've gotten the point across. Definitely willing to take any questions if you have any.
Thank you. Any questions from the committee? Seeing none. Thank you.
Thank you for your time.
Emma Savigny? Just a reminder, we have 4 more speakers.
Good afternoon, and thank you for hearing my testimony. My name is Emma Savini. I'm the Children's Behavioral Health Policy Coordinator at New Futures. New Futures solves problems through policy change, and we are dedicated to supporting a comprehensive system of care for children's behavioral health. We are here in strong opposition to House Bill 1660 because it would create barriers to youth receiving necessary medical care that has been shown to improve mental health outcomes. In addition, it would create inequities between young people who have Medicaid and private insurance. I would like to just underscore the lived experience and the personal stories you've heard today. Those are excellent and very eloquent illustrations of the mental health implications that receiving this type of care can have on a young person. The data is clear that these stories are not outliers. These stories are very common and clearly show that when children and young people are able to have access to medical care, it reduces some of the negative impacts that the feelings of discrimination that trans young people face cause. When trans young people are feel discrimination, they have higher rates of depression, self-harm, isolation, and suicidality. However, when they are able to receive the medical care they need, those feelings of discrimination are reduced, and so similarly, those dangerous consequences are also reduced. They have better mental health outcomes. As such, New Futures is opposed to House Bill 1660 and would ask the committee to vote ITL. Happy to take any questions.
Thank you, Emma. Any questions from the committee? Seeing none. Thank you. Beth Scare?
Beth Scare from Nashua. I just want to let you know the Supreme Court, the U.S. Supreme Court did rule on an Idaho ban on gender confirmation treatments for kids, and that came down yesterday.
So that answers your question, Senator Avard. So I am a grandmother from Nashua, and I'm testifying in support of HB 1660 to help protect gender-confused teens from irreversible gender reassignment surgeries. I support this bill because as it says in HB 619, adolescent genital gender reassignment surgery generally lacks both adequate information for informed consent and involves a high risk of coercion for parental consent when parents believe that they are faced with a choice between their child committing suicide or consenting to their child's genital gender reassignment surgeries. And that would apply to double mastectomies as well. It's natural for teenagers to want to individuate and make a new path separate from their families, and they also want to stand out from their peers. Those of us who are neurodiverse have a much tougher time. We have trouble fitting in. We are painfully aware that we aren't living up to our potential. We are bullied and we are excluded from so much. The LGBTQ groups invite neurodiverse kids in and love bomb them and make them feel special. Identifying as transgender helps them explain why they are struggling. Before their parents realize what is happening, their child is asking for medical transition and threatening to commit suicide if the parents don't allow it. And these kids are coached. I mean, I've seen that many times, heard that from many detransitioners. They're being coached. Parents feel backed into a corner. They don't want to lose their child, so under great duress, they may agree to hormones and surgeries. We know so many parents and kids that have gone through this, and in hindsight, they realize it was the wrong decision. New Hampshire taxpayers should not be paying for these irreversible procedures. We should be doing everything we can to prevent it and help gender-confused kids and teens get the care they need for their mental health without medical transition. Please vote ought to pass on HB 1660 to protect gender-confused kids. And I also want to let you know that a detransitioner in New Hampshire, a young woman, has filed a lawsuit against Dartmouth Health for transitioning her. I don't know if it was as a child or not. I'm still awaiting the details, but I believe there's going to be a flood of these suits coming soon.
Thank you, and thank you for your testimony. So could you recite the Supreme Court ruling again?
Yeah, I was trying to bring it up. But my phone froze up.
Beth, you can get it to him.
Yeah, okay.
You can get it.
Oh, I texted it to you.
Okay, thank you.
Thank you.
Follow up?
Follow up?
Thank you. So I did notice that you were in front of the Senate chambers not too long ago, and you were holding a sign because of your position on this particular topic. Did you feel as though you were being bullied for having a different opinion?
Oh yeah, I was harassed and bullied by the trans rights activists. They were literally in my face, trying to shut me down, trying to bully me to leave and not be able to express my First Amendment rights.
Thank you.
Thank you, Madam Chair. You referenced the Idaho decision, but are you aware that was that Idaho decision that the SCOTUS, or the Idaho law that the Supreme Court was deciding on? They decided only on the procedure. They did not decide that case on the merits. Are you aware of that?
No, but I'm just glad to see any protection for kids. That, parents and children are suffering so much under this gender ideology.
And you spoke about bullying. I'm sorry you experienced that. That shouldn't happen. Are you aware also that in those states that have laws targeting transgender youth, that hate crimes have nearly doubled against them in schools?
Well, correlation is not causation. So I expect there's something going on in those states that may, have coincidentally caused these hate crimes, but also hate crimes I've been accused of committing hate crimes. So I would guess a lot of that is, exaggerated.
Okay, see no other questions. Thank you, Beth.
Thanks. And I'll hand it, I have my testimony from my husband too.
Thank you. Jennifer Smith.
Thank you, Madam Chair, and Senator Avard and Senator Whitley. Nice to be here, but I think we should save most of what we've been hearing for HB 619. I'm the former lead advocate for the New Hampshire Public Health Association, and I recall a few years ago that there was a bill brought to the House that would have banned Medicaid paying for circumcision. That's an elective procedure, by the way. And it's done on children. And it met the wastebasket, and I was one of the people testifying against that. There's a reasonable debate to be had about circumcision. Is it useful? Is it not? I actually did not have any of my 3 sons circumcised. So I clearly don't think it's a very useful procedure. But banning Medicaid for paying for something that other insurance pays for is just plain wrong. And make your case on the merits for everybody. And I happen to disagree on the merits of HB 619 quite a lot, but we'll have that debate. So let's not do this. And the notion that, oh, we've got to ban people from being sent to someplace out of state, that's kind of ridiculous too. I mean, if it's something that is heinous, you're going to ban it in many ways, I'm sure. This is not heinous. I know lots of transgender children through PFLAG. I'm pretty active with PFLAG. And, I think it's nonsense what you've been hearing. They are not coached. They are having to bring their parents along who had no idea before their children made it clear to them that they cannot live the way they were expected to live by the gender assigned at birth. And that's just not different whether you've got good insurance or not. And let's not do this. Thank you.
Thank you. Senator Whitley.
Thank you. There's been a fair amount of talk about this Supreme Court decision in Idaho. And just, I want to clarify some information and ask, would you agree that that case, even after it was decided, children in Idaho can still get the care that they need? That the court did not prohibit that, isn't that
Yeah,
correct?
that's my understanding, yes. Thank you.
Thank you. Good afternoon. For the record, Courtney Tanner, I'm the Senior Director of Government Relations at Dartmouth Health. We are the state's largest health system here in New Hampshire. We're comprised of the Dartmouth Hitchcock Medical Center, the state's only academic medical center, and several community group practices, including Concord, Manchester, and Nashua. We also have 3 community hospitals in Cheshire, New London, and Alspecte hospitals. We are concerned about House Bill 1660. As has been stated, there is no other place in RSA 167 that prohibits Medicaid coverage for a medical service. All Medicaid benefit design is contemplated in rules. It's designed and implemented by our Medicaid office, and there are certain services that are covered or not covered, but that's not dictated or described in statute. And so we have concerns about this precedent-setting legislation, if it were to pass, that the legislature would now be designing the Medicaid benefits. We have significant concerns about that. Second, I have some material drafting questions. There's one sentence in this bill that would prohibit quote unquote gender reassignment surgery. That term, I think, is intended to be a term of art, but there's no definition for that term in the bill. So I have some questions, like would that include hypostatus repair, which is a penile surgery that fixes the location of the penile opening? This is reconstruction surgery. It's penile reconstruction surgery that's performed by a pediatric urologist done in childhood. I don't know if that would include that. Would this include a breast reduction for a 16-year-old who is struggling with severe and persistent back pain or other types of medical concerns? I don't know. Would that determination change if this girl had a different sexual orientation? I don't know. Would that determination for a breast reduction coverage change if that person had a different gender identity? I don't know. So we also have some questions. I just want to flag and note that the questions in and of themselves illustrate the danger in legislating medicine. There's a reason why these benefit designs and determinations are done where they are done within our Medicaid office, and any blanket prohibition, we believe, really bypasses that system and would be dangerous to access for coverage for certain persons. I'm happy to take questions. I see there's one ready.
Sorry. Yeah, so I just want to make sure I heard you correctly. All Medicaid decisions are made in rules?
Well, not all of them, but there are rules that contemplate Medicaid determinations. But I know for certain there are certainly benefit coverages that are not made in rule. What I did say is that there are no benefit decisions made in statute. There are no prohibitions made in statute.
And so could rules just tighten up the language, or should there be legislation to tighten up the language should this bill pass?
We have concerns about legislating medicine, and I would argue that contemplating Medicaid benefit design in statute is legislating medicine.
Thank you.
Thank you.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Ava Hawks, and I am the Director of Advocacy for the New Hampshire Medical Society. We are here in opposition to this bill today. And in the interest of brevity and the fact that you all, I'm sure, have bills to introduce and places to be, and it's been a long day, I'm going to summarize my testimony because the previous speakers have highlighted some concerns that the Medical Society also has. So I'll just start with what I have. So the Society is concerned with how this proposed legislation would dangerously set precedent in New Hampshire, as was articulated by Courtney Tanner, Dartmouth, and others, excluding certain provisions of healthcare services from Medicaid coverage and moving New Hampshire in the wrong direction as it relates to health equity. The legislature, and this body in particular, has made it a priority over this current biennium to ensure that all eligible New Hampshire residents, some of our state's most vulnerable residents, have access to our state's Medicaid plan and health insurance coverage. So in that spirit, this bill would disrupt those efforts. I'd also echo other testifiers who particularly Courtney Tanner, who highlighted that the bill's lack of definition related to gender reassignment surgery is unclear. I won't repeat some of the procedures that Courtney Tanner mentioned, but there are others, and I'm not a provider, so I couldn't list them all, but for patients who are intersex, who have ambiguous genitalia at birth, how would that impact them and medically necessary procedures that they need? I believe we have and should continue to trust our state's physicians to determine medical necessity. And then should the intent, and again, I know that the prime sponsor and others have highlighted this, but I did think it was important to note that the American Medical Association, the largest and only national association convening all the state and specialty societies, has gone on record opposing any efforts that deny health insurance coverage on the basis of sexual orientation or gender identity. So in alignment with the Medical Society's position on this. So, and with that, I will end it there and keep it brief, and I'm happy to take any questions.
Any questions from the committee? Seeing none.
Super. Thank you so much.
Thank you, Courtney. Ava. Ava was our last speaker. Is there anyone here that would like to speak that wasn't given the opportunity on 1660? With that, I will close the hearing on 1660 and call it a day.
We're dismissed.
You are dismissed. Hold on. Yes.